right, good morning and welcome, everyone. This is the second special meeting of the Tuolumne County Board of Supervisors. We're looking at our budget. It's August 5th. I'll see, is Supervisor Half, are you willing to lead us in the Pledge of Allegiance this morning? Pledge allegiance to the flag of the United States of America, to the republic which stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Well, thank you all for being here today, and those watching at home. Appreciate your participation in our county government. So I'm going to look to our team of board clerks over here. Would someone like to read our public participation procedures, and then you can go ahead and read our first 9 a.m. appointment for the day?
Public participation procedures. In order to protect the health and safety of our Tuolumne County citizens, this board meeting is open to the public with modifications. Face coverings will be required of all attendees regardless of vaccination status. During the board meeting, citizens physically present who wish to provide public comment will be invited to do so by the board chair. Citizens who are not present and wish to comment should be prepared to use our call-in line at 209-533-6581 to queue for verbal public comment. Options for public access, audio, and video live streaming. The public will not have access for public comments via these media options. They are available for audio and visual only. Number 1, the Tuolumne County website, https://www.tuolumnecounty.ca.gov/745/board meetings. Number 2, access Tuolumne County at www.accesstuolumne.org and click Watch Live and/or /Comcast Cable 8. Number 3, Zoom webinar via computer at https://zoom.us//987-373-85155 and/or call in at 1-669-900-9128 with webinar ID 987-3738-5155. Note, Zoom webinar services tend to have a reduced broadcasting delay in comparison to the county and Access Tuolumne live streams, and it is suggested for the closest to real-time viewing and listening. Important public notice. Under the Governor's Executive Order N-2520 and Order N-2920, members of the Board of Supervisors can participate by teleconference. Accessibility requirements: if you need swift and special assistance during the board meeting, please call 209-533-6581. 9 a.m. Fiscal year 2021-2022 budget study sessions. Health and Human Services Agency, Public Works, Roads, Solid Waste, Airports, Air Pollution Control, and Agriculture.
All right, thank you very much. Great job. So I'll look to our CAO. Do you want to give us a reminder of why we're meeting here today and who's going to be speaking first?
Yes, thank you. So today is our second day of our budget study session for our fiscal year 21-22 budget. And today you have your Health and Human Services Agency. And I know that Tracy just read off all of the departments. We start off with them, remembering that they have several divisions. So you have Behavior Health, Public Health, Department of Social Services, and Ambulance. And I do expect that this presentation will take the entire morning to give you all time to have a conversation with the presenters as well as ask your questions. And they know that their goal is to try and stick to 20 minutes per presentation, which does not include your questions or any other comments you might make. So thank you very much, and I look forward to the presentations.
All right, thank you.
And
good morning.
Good morning, Mr. Chair, members of the board. I did also want to take a quick moment and just show where folks in the audience or maybe watching from home can access some of the materials that we're seeing throughout these workshops. It is located on two places in our website. The first being under the main page. If you scroll down under latest news, you'll see a heading called August 4th through 6th Budget Workshop. If you click on that and then follow the links through, you will come to the page that we see presented throughout these 3 days of workshop. And this is a newsflash. It will eventually be bumped down, so it is placed elsewhere on our website. It is under the administration office and under budget documents. And folks will also note that there is a history of our budget documents here on the website as well for the ability for them to view. So just wanted to highlight that real quick, and thank you.
Thank you. And have we ever done this before, where we have all the budget documents available in real time for people to follow along? This is a new thing we're doing,
The
right?
capability that we're using with OpenGov Stories is new. Of course, we always post our budget documents in accordance with the guidelines that we have to follow. But as far as being able to follow along, this is a tool that we are implementing to, try and increase our transparency and allow this to be public.
Yeah, that's kind of what I was getting at, is we have always posted budget documents, but I'm really proud of the work that you've done, you and all of our budget numbers people have done in each department, because it's a much easier to understand format now. Because when we would go through the budgets in the past, even I would struggle sometimes to understand where the money was going and where it would come from. And so I think we've boiled it down into documents that are easily available online, and that just anybody that's interested in how their tax dollars are being spent can go online and get a pretty clear picture of where that money's going. So I really appreciate it. It took a great deal of work, and I just really wanted to highlight and salute each of the department heads, and also you, Jason, for the work that you've done.
Well, as I'm standing here longer and longer, my breathing is getting heavier, so my glasses are fogging up, so I'll do the best I can. I'm sorry.
Good morning.
Good morning, Chairman Campbell, members of the board, Ms. Creel, Ms. Riggs. My name is Rebecca Espino, Health and Human Services Agency Director. As you heard earlier, the Health and Human Services Agency is comprised of behavioral health, public health, ambulance and social services, and then just recently, we've included a homeless advocate position under the Health and Human Services Agency. But before we begin our presentation today, I do want to take this opportunity to recognize members of your Health and Human Services Agency leadership team that are both here in the audience and watching this presentation from their offices. Any and all successes is because I have the privilege to be surrounded by Health and Human Services Agency leaders who are brilliant, dedicated, hardworking, and they have a passion to serve this community. Our leadership team are fierce advocates for their staff, which is well balanced by demanding excellence in their staff. I want to express my deepest gratitude for the leadership team's support, for not letting me fall when things got tough. I could not do this work without them, nor do I want to. I also want to thank over 200 plus Health and Human Services Agency employees who have dedicated their careers to serve this community. The sacrifices made during the past 18 months have not gone unnoticed. Staff worked overtime, weekends, late evenings to ensure the community's needs were met. We asked employees to serve the community in new ways, change their work environment, and to do their public service behind masks. Your HHSA employees adapted, persevered, and remained laser-focused on their work. I am so very proud and appreciate every single one of our employees, and we are HHSA strong. Our first presentation will be from Public Health.
Thank you.
There we go. Try this again. Good morning. I'm Michelle Giacchetta, Public Health Director. This morning, we will share a brief overview, first of all, of the Public Health Department, which is a department under the umbrella agency of the Health and Human Services. And our mission is to promote and protect health and well-being in Tuolumne County. We have over 25 programs within the department which focus on the 10 essential public health functions. To cover a few highlights, as your board and the public are well aware, a focus for public health over the past year and a half has been the COVID-19 pandemic response. This includes an ongoing broad activation of our Department Operations Center. As an example, the investigation of nearly 3,200 community cases, which don't include the Sierra Conservation Center inmates, contact tracing and symptom monitoring for tens of thousands of contacts and cases to help mitigate further spread of the virus. We've administered approximately 21,000 doses of COVID vaccine with the help of 55 disaster healthcare volunteers who donated almost 1,500 hours, as well as local community emergency response teams, or CERT, and other assisting agencies. The writing, receipt, and ongoing management of multiple COVID grants, recruitment, orientation, and training of many new COVID response staff. In addition, our local oral health program has established a formal partnership with UC San Francisco to host dental public health residents. Tuolumne County is one of 6 counties that was selected by UCSF and the Office of Oral Health as a host site. And we were selected by the Office of Oral Health to present on our Smile Keepers partnership and school-based services. Some of the top challenges that we face are the potential financial liability of increased jail medical costs funded by public health, the expansion of chronic disease prevention programming, recruitment and retention of qualified medical and fiscal staff, diversion of staff from regular public health programming to the ongoing COVID-19 pandemic, and the planned relocation to the former Tuolumne General Medical Facility. Looking forward, as we address these challenges, the Board of Supervisors has taken action to limit jail medical contract liability costs not to exceed $1.2 million for public health. And we will be looking to research and gain successful award of grants to focus on chronic disease prevention and community health improvement planning. And we have contracted with an outside recruiting firm for the health officer recruitment and planning and identifying solutions for successful recruitment and retention strategies. And I stepped over you, but and utilize grant funding to hire full-time and part-time COVID-related grant-funded positions to allow our permanent full-time staff to focus back on regular public health programming. And ongoing participation in the Tuolumne General Facility Relocation Committee as it pertains to communication, preparation, strategic planning, and problem solving with the goal of an efficient move with little or no disruption in services to the public and ensuring continued positive morale for our staff. And I think I rolled right over Jad's budget fiscal piece, but I will hand it over to him now to talk about our budget piece.
Thanks, Michelle. Let me get back onto the right space.
So, back on the floor, 4th floor, I see. Couldn't stay away, could you?
I'm not planning on being here for long.
Well, we'll see how your presentation goes.
So for the 21-22 budgeted fiscal year, we have 27.4 full-time equivalent FTE. There are some vacancies that, currently that we're trying to fill. As you can see, the number has increased over the last 2 years as we've brought on program staff using available grant funding and increasing grant funding. Many of these positions, especially this current year, are grant funded using allocations and funding from the state and federal government in response to the COVID pandemic. They are grant funded classifications, so we will have to relook at the makeup of our team once those funds go away. In addition to bringing on these additional team members and numerous relief staff, our current team members have had to divert a good portion of their time to the COVID pandemic and have not been able to draw down as much of their regular program funds as they normally would have. So for the 21-22 fiscal year, the recommended budget beginning fund balance has a conservative estimate right around $1 million. That includes our contingencies from the 2021 fiscal year. This is the reason why you'll see a higher expense amount versus the revenue, as we need to balance our budget with including the fund balance. However, the expenses does include about $375,000 of budgeted contingencies, which may be revised in the adopted budget as we close out the fiscal year. Let me just take a minute to clarify. Public health is made up of our tobacco, WIC, and CCS cost centers, and those will come in future pages. But they all roll up to the same public health fund. So some of those you might see have a net expense and or net cost, and one does have a net income, and they all work together to balance each other out and roll up to our ending fund balance. So looking at public health, majority of our revenue comes from grants, allocations, and realignments, although we do have a small amount coming in from fees and services. We have staff funded in over 30 different grants, and we're always looking for new funding opportunities. Realignment is provided by the state to cover mandated programs, and it comes from sales tax and vehicle license fees, so it does move up and down with the economy. Unfortunately, or fortunately, even though we can't forecast this year, it does look like we will anticipate some growth funds in the 21-22 fiscal year. If we're going into expenses, all right. Salaries and benefits are our largest expense. Thank you. So that's our revenues on the top. Yeah, salaries and benefits are our largest single expense, and our largest non-people costs is, as Michelle alluded to, the jail medical contract. It has been capped, but it is still about $1.27 million. Which doesn't include dental and sort of hospitalization costs that might arise throughout the year. So that's public health as a fund. Is there anything you want to add before we open up for questions?
I don't think so, until we get to the other cost centers. Do you want us, should we cover the other cost centers first for public health, or do you want to take questions now?
I think if we have questions, we'll dive right in.
Okay,
Great.
So I would just go ahead and
okay.
continue with whatever you'd like to
Now
talk
for
about.
tobacco
We won't be shy.
Okay, great, excellent. Okay, then we'll move on to our tobacco control program as just one of the many programs within public health, which I mentioned earlier, but it has its own cost center. The program uses Prop 99 and Prop 56 state funds to improve the health of Tuolumne County residents by reducing illness and premature death attributable to the use of tobacco products through prevention and education services. The net cost for this program is covered by the Public Health Fund. Now, this time, do you want me to stop first?
Sure.
Okay.
So tobacco is budgeted for 3 people, although some of those people split with other programs, so it really ends up being about 2.3 FTE. As Michelle just said, many of the costs or any overrun costs would get covered in by the other programs within or realignment within public health. However, the 2 tobacco funding sources do cover the majority or all of the direct expenses and a large portion of our indirect administrative type costs. For the 21-22 year, we have revenues of about $405,000 and expenses of $443,000, so that's about $40,000 that needs to get covered by the main program. Let me roll on.
So some of the highlights we'd like to share are the completion of a 5-year needs assessment that was done by the tobacco team, completed an annual tobacco retail sales surveillance activities, the ongoing facilitation of something we're very proud of, our youth coalition is called EPIC, which is Empower Peers, Inspire the Community. And we did a tobacco cessation facilitator training for county staff and our community partners. Some of the challenges that the program faces is re-engaging community outreach efforts as the pandemic restrictions are lifted, policy implementation surrounding tobacco retail licensing and clean air ordinances, and the staffing challenge with recruiting and filling the program coordinator vacancy that's been vacant for some time. And looking forward to address those challenges, we will be refocusing on community outreach, education, and coordination, and redirecting, hopefully, our permanent staff from COVID response activities to tobacco program, and continue our recruitment efforts. And that's it for tobacco.
I'll jump in real quick here on the program coordinator recruiting. You said that's been vacant for some time. Is there a reason that you're having a hard time getting somebody to fill that?
No, I think it's just a lot of shifting of positions within, again, part of the pandemic response. And then we actually do have someone that should be onboarding and starting on August 23rd. So,
Great.
yeah,
Thank you.
so we're excited about that.
Good.
Okay, WIC, or Women, Infants, and Children Program, serves pregnant women at any stage in their pregnancy, infants and children under 5 years of age, breastfeeding women up to a year postpartum, and non-breastfeeding women up to 6 months, and all foster children under 5 years old who meet eligibility requirements. All documented and undocumented persons in a family who meet eligibility requirements, and grandparents or guardians may receive benefits for eligible infants and children under 5, and single parents may receive benefits for eligible infants and children. It's an income-based program that provides nutrition education and benefits for healthy foods, breastfeeding education and assistance, including lactation consultant and breastfeeding aids, and referrals for services.
So WIC is budgeted, our WIC program is budgeted at 4.5 FTE, and which does not include several relief peers specialists. Budgeting for this program is similar to our tobacco. We have grant funding, and any of the indirect or administrative costs that cannot get covered by the grant do roll up into the main fund. This one has revenues of about $650,000 and expenses of about $705,000. So a net cost to the fund of about $54,000 there.
We did want to share that the WIC program has served over 700 families the past year, including 171 new families this past year. We had over 2,200 contacts with our clients, including enrollments and classes, had over 250 lactation consultant visits, and over 480 breastfeeding peer counselor encounters. Some of the challenges that the program faces is a statewide increase in WIC caseloads as compared to a decrease in caseloads that we're seeing in Tuolumne County, a reduction in referrals from our community partners, and a lack of timely communication from clients and providers to our WIC staff concerning breastfeeding assessments. And to address those challenges, we're looking forward to increasing our outreach and engagement and messaging in communities, community outreach and coordination with our partners to improve that communication and referral system.
Thank you, Michelle. And I just want to say I did a lot of I guess I was a parking attendant, I think, on the campaign at the Peaceful Valley Farmers Market up there.
Oh, yeah.
Because it was a great way to meet people. A lot of folks came in. It was near a shop. I believe WIC was there every time, having a booth, talking to all the people coming out there. And food security is just so important here, especially for all the children in our region, and parents too. So thank you for all the work with this. I have seen it, and I love that type of outreach. I love that type of engagement. My only question on it would be specifically, because I wasn't aware, I would have expected the caseload to increase here too, especially with the kind of pandemic needs happening. Has there been, and this might be getting in the weeds, a digital advertising effort kind of targeted at local young parents and mothers to be able to regularly boost this and let people know it's available?
I don't know all of the details of that. I do know that they do some advertising. They've done stuff on, like on the Tuolumne County Transit buses, and I believe at the movie theater, on the advertisement there. And they do have a pretty good social media presence, and I will ask our WIC coordinator, director, if we can get some more details on the outreach that's done. But I know that that's gonna be a focus this year, is increasing that outreach
Great.
and referrals, yes.
Yeah, thank you on that. And I guess I'm specifically looking at social media, and if there was a
okay.
budget to be doing that on a regular basis. And if it isn't, I would definitely love to see a proposal for that in the future. So, thank you.
Okay, sure.
And I see lots of the expenses for the public health budget as a whole. I can't completely confirm if it's for WIC or one of the other programs, but I have seen us pay for Facebook boosted posts and trying to get the word out. And you did really well out there. I did not see a single accident in the parking structure around the farmers market.
Yeah, and it's been nice, actually, WIC has been able to provide vouchers for farmers markets as well as their regular food services, so I think that's a really great plus as well. Okay, the final cost center for public health is the CCS, or California Children's Services, which is a medical program for diagnosing and treating people from birth to 21 years of age who are diagnosed with certain physically disabling medical conditions. Some of those conditions include, but aren't limited to, cancer, hemophilia, cerebral palsy, cystic fibrosis, and some traumatic injuries and infectious diseases that will cause long-term injuries for those youth. And I'll have Jad talk about that, but sure.
So in the cost center, there are no FTE. However, we do have several staff who sit in the main public health fund who do work on the program, including one person who is 100% in our CCS program. The funding for CCS is sort of interesting. We have Medi-Cal funding, which comes from the federal, as well as some state grant funding to cover what's not covered by the federal piece, since Medi-Cal is only a percentage that's covered. In addition, CCS has its own realignment funding, as this is a mandated program. So for the 21-22 year, we have revenues of almost $600,000 and expenses at about $366,000. So this is one of the programs that has a net revenue for the public health fund and helps cover some of the other uncovered programs.
Thanks, Chad. So to share a little bit about what has gone on this past year, that we provided services for 189 children and young adults. The CCS Medical Therapy Unit and Occupational Therapy provided services to 38 clients. And we were able to implement the UC Davis, it's a mouthful, School-Based Telephysiatry Assistance for Rehabilitative Services, or STARS, the telemedicine program. And some of the top challenges that we face are staffing is a major challenge right now with an ongoing nursing staff vacancies and succession planning. The medical therapy unit location concerns. We need an alternate school site, so that's something that we've been working on for some time. And coordination with state agencies, as we're an independent county program. And moving forward, we will continue our succession planning and recruitment efforts and coordinate with the county's SELPA, or Special Education Liaison, to identify a new MTU school location and advocate for clear communications, policies, and procedures from the state oversight agencies. And that's it for public health, unless there are questions.
Okay, any questions, or else I'll see if there's any public comment? Okay. All right, Thanks, guys. Great
Sure.
job.
And I'd introduce next Steve Boyack and Katie Andrews, and leave Jad here to talk about ambulance.
Morning.
Morning, Mr. Chairman, members of the board. You heard our boss, Rebecca Espino, just speak about her gratitude towards our HHSA leadership and our staff a moment ago. I'm here to tell you that we wouldn't be here if we didn't believe in the vision and the leadership of our boss, Rebecca Espino. There is no more dedicated public servant than Rebecca, and I want your board to know that. So, ambulance. We've had the luck, I guess, to be before your board twice this year to discuss ambulance issues in great detail. So, again.
Hey, Steve,
Yes.
I'm sorry to cut in. Hey, I just want to say thank you for saying that. I know you were in the bid for the position, and that speaks a lot about your character to really praise your boss like that. So thank you.
Thank you. So our ambulance program. Our ambulance program is a program that is an enterprise program. It is primarily user fee supported. It contains two cost centers, one primary cost center, our ambulance enterprise fund, and our Groveland cost center. And together we balance those two for our ambulance fund. Our ambulance primarily provides emergency and non-emergency transport services. We also provide standby services for various events when requested by these event coordinators of our ambulance service. We also bill internally for and obtain reimbursement for services provided. And we sustain the ambulance enterprise fund by making sure that we are carrying out capital improvements and capital equipment purchases to maintain what we have in our program. Katie's here today, and Katie is our newly minted, if you will, emergency services coordinator. And she also has a dual role in our COVID response as our infectious control assistant. And so she is going to speak more about our program highlights.
So for last fiscal year, Tuolumne County Ambulance responded and transported approximately 8,339 individuals. And the EMS agency, along with the ambulance, implemented a new electronic patient care reporting system that allows us to improve our revenue reimbursement and data collection for state reporting requirements. We've also updated several of our policies to include local optional scopes for EMT basics, I should say, for Narcan administration and epinephrine administration for allergic reactions, along with using glucometers to check for blood sugars in diabetic patients. I'm going to come back to the video laryngoscopy. We've also incorporated high-performance cardiopulmonary resuscitation, or high-performance CPR, and push-dose epinephrine into our treatment guidelines. For COVID-19, EMS providers and administration were agile and flexible to create new policies and procedures and have been providing the best care for patients as well as self-care for staff and providers. Tuolumne County EMS Agency has instituted COVID-19 testing and vaccination services for those in Tuolumne County and got the video laryngoscopes to be able to view airways better for intubations. They also added more efficient and effective COVID-19 sanitation systems throughout all of the ambulances in an aeroclave device that kills all the germs.
Okay, so I kind of skipped over Jad, unfortunately. We wouldn't have program successes without our budget and those that monitor and build our budget. So Jad is going to speak to the ambulance budget.
All right, so I'll briefly just touch on our FTE. So since we contract with Manteca District Ambulance to actually provide the service, technically the county only employs 2 staff fully in the ambulance enterprise fund, and they are our exceptional billing team. Looking at the fund budget. So in the recommended budget, we anticipate starting the year with a beginning fund balance of 1.8 million, which is the difference between, as you can see on the screen, the difference between our expenses and revenue. The ambulance fund is an enterprise fund, so we cover our revenue, our expenses with generated revenue. And as you can see, we have, with minor ups and downs absorbed by the fund balance, we are flat over the last few years. And at the end of this year, our contingencies will allow us to remain flat again. With rising minimum wage and salaries and the cost of services, our expenses to continue to go up, and our revenues, we work on and do what we can to make sure they continue to match those expenses as well.
Thanks, Jad. So balancing the ambulance enterprise fund is a challenge in itself. As your board knows, we have certain users within our system, certain sectors within our system that don't pay for other pieces of our system, and we have to balance those pieces, and that is an ongoing challenge for us. We've been before your board earlier this year. Your board agreed, and we did raise rates in the ambulance enterprise fund to take care of primarily a increase in contract fees through Manteca District Ambulance that was extremely needed. And there are some other things on the horizon that we want to pay close attention to. I mentioned that the Ambulance Enterprise Fund is made up of 2 cost centers. The Groveland Cost Center does have some revenue coming into it that we have to pay close attention to. And one of those revenues is a parcel fee that the Groveland residents have chosen to really tax themselves to make sure they have a 24/7 ambulance up on the hill in Groveland. And that parcel tax does have an expiration. It is June of '23. And so we will be working with Supervisor Half here in the near future to roll out presentation and programming to go to the Groveland residents about what the parcel fee is and what it pays for, the fact that it does expire, and our intent to place back before the voters of Groveland, most likely June of '22, because I don't know if there's an election in '23. So it's a full year before it expires, to place an item back before the voters in Groveland to extend that property tax to maintain 24/7 ambulance services on the Hill. So that's coming. We also need to pay close attention to reimbursements from Medicare and Medi-Cal. And your board, when you're speaking with your federal representatives or your state representatives, either or, those reimbursement levels are critical to Tuolumne County operations. As your board knows, 80% of our transports are made up of those 2 cohorts, and those 2 cohorts do not pay for the services that are provided. They are extremely, extremely important for us to pay close attention to. So moving on into the future, we have some upgrades we're doing in ambulance infrastructure that's going to make our ability to obtain reimbursement quicker and more efficient by upgrading software billing infrastructure and getting laptops that currently exist in the ambulance, but upgrade those laptops to make those operations more efficient. So with that completes our ambulance report. We'd be happy to answer any questions.
All right, any questions? We'll see
Yeah.
if there's public comment.
I've got one. We discussed this previously when we were looking at the rate hikes, and I'd asked a question at that time regarding what has previously been presented to the board as unrecoverable fees from foreign visitors that were taking ambulance rides. And I know it's pretty problematic, right? It's not like you're going to ask for a credit card from somebody as you're loading them into, an ambulance. But I was just wondering if any progress has been made on that. We discussed briefly exploring, possibly a relationship with the hospital, billing something. And I'm still interested in it. It's not a lot of money, but it could be 50, 60, 70,000. And certainly we've got plenty of areas, that, could be used for other things within the program.
So what I would like to say to that is you're absolutely correct, Supervisor. We are before your board at the end of every fiscal year to do something called a discharge of accountability. And a discharge of accountability is an item that's brought before your board to discharge from our ledger, our budget ledger, those services that we can no longer collect for. And in many cases, they are associated with foreign visitors that require ambulance services here, and we have difficulty collecting for those. But I'll just say this. Over the last 2-year time period, our senior biller, Michelle Sliker, has been very successful in decreasing the amount of discharges that we bring before your board through reaching out to not only the person, but maybe who represents the person to be able to negotiate a settlement. Now, I'll just say those settlements are lesser than the service provided, but it's still something. And so we've been able to really cut the number of discharge accounts that we're bringing before your board, but we're still going to have to do that on an annual basis. There are a number of services that we are just not able to obtain reimbursement for.
Okay, thank you. I appreciate the efforts,
Okay.
to do what you can there.
Okay. Is there any
Yeah, I have
public?
a question. Thank you. Regarding the Groveland parcel tax, that requires quite a bit of education, and if we're going to go for next year, that education probably should have started. And I am aware that we're all busy with budget this month, but I'd like to get started with you as soon as possible in September to start crafting how we're going to educate the public as to what this means to them, because there's a lot of new people now in Groveland as well that never went through it the first time. So we'll need to really get out there and make sure everybody understands exactly what this is all about.
Absolutely, Supervisor. It was our intent to get past adopted budget and reach out to you for that effort. I've been in contact with Debbie Batista, our clerk, to talk about the election in June and what the timing is behind making sure that we check off all of the required sequence of approvals from your board to get this item on the ballot for June. So I know what those timelines are, but absolutely, we need more, the more sooner the better. Absolutely.
Okay, thank you.
Okay, if there's
Oh.
no,
Yeah,
I'm
I got a
sorry,
few.
I'm Jared.
Clear
All
my
right.
thoughts.
No worries.
Yeah, I appreciate you coming back, being able to present on this. I think the first time you came before the board, it was very clear that the enterprise fund was not stable. And that was threatening ambulance service for our residents, really, and the contract itself that we've had for how many years was it?
1987.
Yeah, okay. So quite a few, and it's worked pretty well. And so my question to that is, seeing with the revenue expenditures, with those changes, is this now a stable fund?
Well, that is a great question. The first rate increase that your board so graciously allowed to occur happened last fiscal year, March 1st. So we had 4 months of a 25% increase in rates. And then we increased the rate again by 25% on July 1st. So the answer is yes, revenue is ticking up. our service level is also ticking up. The number of transports out of county that I think were diminished because of COVID have started to really increase. So we're starting to see some revenue generation there as well. But I think what we're seeing right now from a trend point of view, that we are starting to receive the result of that rate increase. And we're looking to make sure that that rate increase we brought before your board is something that will sustain operations into the future. If not, we'll be back before your board.
Okay. And I think as we talked about then, it was, a serious amount of money for somebody to get, but at that point, it's the level of service we want to provide. We want to make sure that they can get that ambulance at the right time. And I think that is what everybody would put as their first priority in calling 911 and calling those services. Have you had any significant uptick in responses from the community saying that this was unreasonable, they wouldn't have called the ambulance if the rate hadn't increased? Have there been any changes in the communications?
Well, oddly enough, I do receive those complaints, and so does Katie. And I don't think we've received one complaint. Not one.
That's really great.
Yeah.
That's really great. Well, I'm happy. It's always nice to be able to get a problem, then you're able to solve it, and hopefully not maybe forever, but for a little while. I wanted to ask about the dispatch contract, and I think this is something that just going back to a little bit with yesterday. I would certainly love to know more information about how that system works as to who's actually called out, what units need to be there. For example, does fire respond to the medical units? When is an ambulance called in? Does law enforcement show up to that? Specifically, I was wondering if you could just elucidate a little bit on when an engine would be called versus when an ambulance would be called, and why, because that was one of the big concerns yesterday, at least for me, was 70% of fire calls were medical, and we do have an ambulance service. I wasn't quite sure of the reasoning.
So the sheriff's office does what's called emergency medical dispatch, and they have a system where they go through a series of questions to determine if an engine is needed. And those calls are broken up into 5 different categories: Omega, Alpha, Bravo, Charlie, Delta. And then all Omega and Alpha calls are considered low priority calls, to where just an ambulance is sent and a fire engine is not also sent. However, some fire districts still choose to respond to those code 2.
Interesting. Okay, great. Thank you. That I think pretty much answers it there. I also saw that you had the patient record keeping system that you mentioned, which is really great. As you know, we're trying to move everything as much as we can to digital, so to see that all in one nice system is fantastic. This is just a footnote, but if that is something that can be employed by, again, looking to fire for medical calls, if there's any way to integrate that, or if it really is a HIPAA, it has to be exclusive just to an ambulance service. Just a little bit more info on it, and we don't have to go into it now because it's gonna be getting into it real technically. But I'd love the name of the software and a little information on how it can be applied in other areas. I think we already covered reimbursement for it. So thank you so much for your time. Really appreciate it.
All right.
Steve, I do have one question.
Sure.
On that note, with when people call 911 and people respond, how much work and how would I get the numbers of engines that respond that are not required to?
I'm going to guess it would be through the San Andreas Dispatch Center with CAL FIRE. It's typically districts that want to support their areas and their citizens that respond to those. I won't say that it's every call, and there are Alpha and Omega calls where ambulance does request fire to respond as well for
Could
lift
you
assist.
get just a slightly bit closer to the
Oh,
microphone
sorry.
so we can all hear what you're saying? Thank you so much.
So sometimes ambulance does request those fire departments to respond, but again, the citizens in those areas expect fire to respond, or fire expects to respond to those calls. So I would imagine San Andreas Dispatch would have that information.
Okay. Okay, thank you.
I'd just like to weigh in on that a tiny bit, just, based on my background in the fire department as well as managing the 911 center. It gets really complex when you look at emergency medical calls and who to send or who not to, and what you really have to always fall back on is closest resource, right? It's expensive to send a fire engine, but if they get there 30 seconds or a minute, before an ambulance, that can be a lifesaver. The other thing is the complexity of the calls, because an ambulance crew might have 2 people on that ambulance, and many calls could require more people, more personnel to deal with the emergency at hand. So there's no cut and dried answer. This is something that's been debated and discussed many times in the past, but we always have to rely on the closest resource being the primary consideration and making sure we have enough people there to do the job correctly. So I just wanted to weigh in on that. Thanks.
All right, is there anyone that would like to speak from the public? No? Okay. All right, thank you very much.
All right, Mr. Chairman, we are going to move to behavioral health, and from behavioral health will be Michael Wilson, Tammy Mariscal, Brock Colby, and Jad will stay at the table and talk about their budget. Thank you.
Thank you. Good morning.
Good morning, Board. Michael Wilson, Behavioral Health Director, and I will start once we get it up. All
While you're
right,
setting
so I'm
up.
going to do a quick overview of behavioral health. And as you know, behavioral health is both mental health and substance use disorder services, primarily focusing on treatment, but we do prevention and outreach both with mental health and substance use services. A lot of our prevention is contracted out. As the state's local provider, we do provide specialty mental health services and such services to Medi-Cal beneficiaries primarily and the uninsured. The qualifying individuals have to have a serious mental illness or a substance use disorder that meets medical necessity. Services are primarily outpatient, consisting of case management, rehabilitation, therapy, medications, triage, crisis, inpatient treatment monitoring, managing clients placed in long-term facilities, supportive housing, prevention, outreach, engagement, peer support, in custody and judicial services, and outpatient substance use disorder services. In addition to the service delivery system, BH also manages a quality management program which ensures provision of the various functional areas required by state contract and other associated federal standards to maintain program integrity. With that, I think I'll pass it on.
Oh, sorry. Some key performance measures for this year are we served 3,818 clients in the fiscal year, and that includes both outpatient and crisis for our community. We improved our timeliness for first appointments from 16 business days in the previous year to 11 business days. Our Eternal Quality Review Organization, which reviews our program annually, found that we had improved communication between clinicians, case managers, and psychiatrists that resulted in improved care. They also looked at a data for our penetration rates for our foster youth, and we're happy to report that it exceeds the state average by almost 10%, from 62.32% of targeted versus 53%. Feedback in focus groups also reflect the staff participation in committees, system planning, and mental health plan initiative and policy development. We organized and facilitated the first virtual behavioral health town hall that focused on mental health services in the community. And we are an active partner in supporting mental health services for the homeless and particular efforts with Camp Hope. So that's just a few of our measures. And I'm going to introduce Tammy Mariscal.
I think we might try to get this one right and go straight to Jad. I think budget is next. And while he's bringing that up, I just wanted to thank my administration as well and the board for the attention to behavioral health matters. We have a wonderful behavioral health advisory board now that's very active and dynamic and a joy to work with. And I'd also would be remiss not to thank all my staff who have, like public health and other departments, are doing overtime. We are short-staffed. We have COVID outbreaks which wipe out a team, and people have stepped up. We have the demands of other pools on our time, and people are volunteering and doing the good work. So I just wanted to take that moment.
Thank you. So for the 21-22 fiscal year, Behavioral Health has 63.9 FTE on the team, which includes clinical, program, billing staff, quality assurance, management, and support staff. The department has a beginning fund balance, or it's budgeted at a beginning fund balance of about 1.5 million, which includes the full fiscal year 2021 contingencies of about 830,000. We're hoping to see that number increase when we finish closing out the prior fiscal year. The approved recommended expenses in 21-22 are 12.8 million, with contingencies currently set at 790,000. Again, that number will change once we finalize the closing of the books. Behavioral health is made up of 3 cost centers: the main behavioral health program and our 2 housing cost centers, which we'll touch on a little bit after, as they are their own page. Behavioral health has quite a few sources of funding, including our MHSA and SAMHSA from the state, which also provides realignment funding for this program for behavioral health. And then from the federal government, our SABG block grants and our FFP funding for various mandated programs. And I'll move over to Tammy.
Thank you, Judd. Good morning. To cover some of the department's challenges, we are no different than a lot of the departments that spoke this morning. We are experiencing ongoing recruitment and retention challenges of clinicians and program supervisors. This impacts our ability to consistently meet state and federal regulations, to fully participate in mandated partnerships with other departments, and to fulfill grant obligations. We experience disproportionate standards and audit requirements compared to other behavioral health systems who contract with the Department of Healthcare Services. We are also facing a significant whole system conversion called CalAIMS. CalAIMS is a multi-year initiative proposed by the Department of Healthcare Services aimed to improve quality of life and health outcomes for the Medi-Cal population by implementing a broad delivery system, new programs, and payment reform. As an example, BH will transition from a cost-based approach to one that is more streamlined and aligned with industry claiming standards and is intended to be expeditious. A reorganization of the department staff and responsibilities is necessary to support our current clinical and business processes to be more efficient. This will allow us to accommodate the CalAIMS and the department's pending electronic health record transition, as well as operationalize and to be prepared to maintain the pending drug Medi-Cal program. The drug Medi-Cal program will bring increased responsibility of administrative oversight, monitoring, data collection, and analytic capabilities, which are nearly identical to the current system in place for behavioral health, mental health, managed health plan. Those are some of our top challenges, and with that, I will pass it back to Michael if anybody doesn't have any questions. Thank you.
I have a question about CalAIM. You had said it was streamlined and efficient, and my question is, will it recover your costs?
It is intended to be streamlined and efficient. Kathleen, one of the takeaways from the proposed CalAIMS is that they are going away from the cost-based, meaning that is simply about the provider services, direct service expenses, to where they're looking at making our services whole. Do you want to speak to that anymore, Michael?
California is advancing and innovating. Medi-Cal is a huge task. It, as Tammy said, from CPEs and cost reporting to IGTs or intergovernmental transfers, and so that we are really more of an outcomes-based payment model instead of, these audits and, being at risk 6-7 years in arrears. So we are hopeful that the cost structure will benefit the county. Also, one of the main things is with the 1115 waiver and the IMD exclusion. So we currently pay, when we place people in long-term psychiatric facilities, at an astounding rate and sometimes, and that waiver hopefully will include reimbursement for those placements. So there are, and it would be hard to do a complete CalAIMS overview. There's so much to it, but since residential placement costs are probably about 8% of our budget, it's a pretty important aspect of CalAIMS.
So you call it 1115 waiver, is that through CalAIM or is that?
That's the current waiver California has with the feds.
Okay, that's for inpatient mental health care?
That's for almost our entire service.
Okay. Yeah, because I know that's an extremely high cost when we bear it for the county.
Yes.
And so, yeah, if there are waivers we can take advantage of, that would certainly be a good thing to do.
I just have a request, and I don't even know if it's possible. I know the state comes up with all these great ideas, and hopefully it is streamlined and cost efficient and all of that. And it's not one that continues to move more costs to the county. And that's what I'm worried about. That's why I asked the question that I did. I don't know if there's, you're not going to necessarily be doing a cost analysis if you're doing it this other way. So I don't know if there's any way to compare the way you've done business before with the way that this new change, this electronic health record change is going to change the way you do business, but it would be nice to know if it's working. And I don't know how we do that, but I'm just asking that when you incorporate these changes, you have an eye for that. Is it working? And are we recouping our costs? If there's any way of doing that. That's my concern.
Absolutely, thank you. Any other questions?
I've got a couple of comments and a question as well. One item, where you talked about your request time from the initial 16 days down to 11 days, that's a substantial reduction, and that's great. I mean, that's really, really important for, people when they're trying to, get help. So, kudos to you guys for, making those reductions. Wanted to also state, really appreciate your efforts, to assist the homeless population. Camp Hope and I know otherwise, that's really important, right? It's the right thing to do. And the efforts that we put into that ultimately pays dividends, so it's a good positive thing. The other thing, looking at your org chart, the August 1st, 2021, so if I'm looking at the numbers correctly, I see 16 total clinician positions, of which 7 are filled and 9 are vacant. So we've got over 50%, maybe that's closer to 60%. This is not an unknown thing. We've been discussing this for a while, but we're going to have to somehow come to terms with this. We can't. All these positions are here for a reason, right? And if we can't fill them, and I understand that you've looked at some reorging and switching around in some of the positions to, take care of, things. But we're going to have to figure out where to land on this to resolve this. We just can't continue to go on doing business this way. That's, it's too many shorts. So I'm not looking for an answer right now. I know you guys are scratching your heads and thinking about every alternative that you can. And we as a board need to do our part and look at that to see how to resolve that, because it's unacceptable. Thank you.
Thank you, Supervisor, for bringing that up. Those are revenue-generating positions as well, so it's kind of a double hit when we don't have those positions filled. We did make some adjustments with our senior behavioral health workers and backfilling behind some of those. And the good news is, we do have 2 current applications for clinicians, so hopefully we can continue our efforts. And any other questions?
Yeah. Oh, it always takes me a moment. I gotta find from my scribbles where my notes are for this. Well, I want to jump into that actually, because that was one of the questions I had. Obviously, we've talked about this, I think, in your presentations to Behavioral Health Board, and I do appreciate you and your staff being there at every meeting in force there to answer any questions. So that's always very helpful, and thank you for the kind words about the board, because I think it is a really great group, and it's really, really doing a good job. One of them was, so obviously, it's something we've talked about a lot. The behavioral health clinicians in particular, it's a really critical vacancy point too, over 50%. I mean, that's huge, and you said that's potentially jeopardizing the revenue that we're getting for those services, because you're not, it's not that you're just given a pot of money and then that's that. It's, as I understand, how many hours you're with clients, right? And you're able to be, not bill, but be reimbursed for that time and then support the department. What are we talking about as far as numbers for that? Sorry, numbers as far as what it's costing the department to potentially not have those positions filled as far as net revenue. Jad?
The last time we looked at that was, I believe, in 2018 or 2017. And if you were to take the state's Department of Healthcare Services standard of 60% billable per direct service staff and apply it across all of our direct service staff back in 2018, I believe it would be probably well over $1 million in revenue that we're not generating. But Jad might be able to speak a little to that.
And that's okay.
It was before his time.
I guess I just wanted to make the point there and also get the numbers from my own understanding that this is costing us money, not only be able to provide services, but I mean to keep the whole thing afloat too. So I recognize that's a huge issue. I do appreciate the change agent study workshops, meeting with staff and trying to address the concerns that they're bringing up. Obviously, compensation has been something that's been brought up as well. One benefit being that since this is not a general fund department, we've got SAMHSA, it's MHSA. As a member of this board, I can, just speaking for myself, would love to know what the options are for what we can do. I know we do have, obviously, bargaining processes, but information is power in that, because this is a problem I want to solve. I want to be able to fix this, because when we talk about whether it's the homeless camps that we're trying to get folks out of and into individual case studies, we talk about people, in my district, there's addiction and there's people on drugs and there's stuff like that. When we talk about folks, leaving a job because they're unable to find the help or ask for the help, you're the ones that are actually there trying to prevent that, to get them into counseling preventatively, get them help, or be able to act in somebody in crisis, right, to save a life and stop a suicide. And you're there to try and help facilitate somebody getting off of a meth addiction and getting back into life. And a lot of these programs, which are great, like motherload job training, those are all fantastic, but a lot of times you got to solve that initial step, and you're on the front lines of that. So it's a problem I want to see us solve. I don't want this to be continuing forever, and I know we are making slow progress on it, but I want to see something with it, and I know you're working on it, and I appreciate that. I think just beyond that, that was most of it. I got the benefit to be able to pull in your ear just about every single month, except yesterday when our meeting ran a little bit late, so sorry for missing that. One last closing note, I believe that's Tracy right there in the photo, and it looks like we need a new group photo too, because I think Brock had a mustache. I haven't seen him for a long time, so he might still have a mustache. I don't know. Is this a little while ago?
This was recent.
Is that not Tracy?
I think that might be Misty.
Oh, okay.
I'm not sure, but
Well,
that's
never,
not me.
Never mind then. Okay. I thought that might be the move-in photo for when everybody ended up going to Tuolumne General. So thank you for being here. I really appreciate your time.
And thank you Supervisor Brandon. And I'll just touch upon something that you did, and that is if we aren't, not only is it the revenue we may be missing by not being fully staffed, but it's really our partnerships with CWS, probation, the JDF, having staff available to go to the jail, having a clinician at probation. Those partnerships, those efforts are preventative, sometimes direct treatment, but that allows us maybe to avoid future cost and definitely hopefully avoid future placements where people have to leave our community. So it's a complicated issue, and we are making progress. We talked about the timeliness, and I think it's even up to 8 or 9 days now, so it's even improved since this report. We do have some good things coming, looking forward to. The strategies, we always are constantly strategizing and analyze alternative service delivery methods to identify the most effective programming to meet our client needs and adjust our organization accordingly. So we are constantly looking at data, and you would have gotten quite the education yesterday at the Behavioral Health Advisory Board as Lindsay, our quality, our agency manager, did a great overview of our external quality review organization and other data, which is just expansive and allows us to be flexible and adapt and improve. We are focusing on training and to provide administrative oversight, transitioning to a new electronic health record, which is a big lift. We already mentioned CalAIMS and Drug Medi-Cal. One of the things that's also in short order has come up is we have like 4 different grants. So SAMHSA, which has the federal block grants, the substance abuse block grant, the mental health block grant, has supplemental funding, probably in the order of about a total of about $700,000 that we will have to partner with our contractors to draw all that money down. We have 2 other grants, Behavioral Health Quality Improvement Program, which is a guaranteed $250,000 for this quarter and next quarter to allow us to prepare for CalAIMS. And there's additional funding with that grant as well. And then probably of more relevance with our triage work that we do, which is coming to an end in November, there is another grant, the Crisis Care Mobile Units Program. It's a guaranteed $500,000 if we apply, and there's additional money there to provide, as it says, crisis care on a mobile basis with a primary target of youth, so 25 and younger, but it's not exclusive to youth. So we have some funding opportunities which will allow us to continue some of our good work, the triage and crisis, and hopefully expand a little bit if we can have the staff to do it. Then we're going to go to our other cost centers. We have 2 housing units. And behavioral health housing. So we have Cabrini House and Washington House, county-owned, provides low-income housing for severely mentally ill. The program was established, Cabrini was established by the Mental Health Services Act Fund. It serves females. The supportive services we offer are a full range of our mental health services and substance use if they should need it, as I mentioned earlier. The Cabrini House is a total of 5 beds, and it remains pretty much full all the time. And the Washington House has 6 beds. And to talk about the budget, I will turn it over to Jad. And Washington House primarily serves men.
So the housing fund balance has a beginning fund balance of about 56,000. Which includes some restricted funds for potential repairs, I believe, or future fixes. The funding that covers the expenses in this program come partially from revenues generated as the tenants do pay rent, and then the remaining is covered out of the main behavioral health fund. For the Washington House, for the 22 year, we have budgeted expenses of $49,000 and revenues of $21,000. This doesn't show the Cabrini House. I can pull that up as well I think it is separated out, but we can go into any of the next piece here first. Who's talking?
back to housing.
Yeah, it's just more housing. So it's the two houses, 5 beds, Cabrini, 6 at Washington, 1 serving men, 1 serving women. I think we've maintained a pretty steady census. We've maybe served 1 additional or 2 additional individuals as people have come and gone than the capacity that they serve. So with any questions about our future directions or our housing?
Yeah, I do have just a couple of questions with that. So, for example, with Cabrini House, so what was roughly, this is maybe a little outside the budget, but bear with me, just what was the time to start a program like that? And the initial kind of startup cost? Obviously, there's a lot of need in the community. We're kind of having some relevant discussions right now. A lot of these people, this is the cheaper option actually in the long run is putting them in a stable housing situation where they're not on the streets and they're not facing a lot of these other emergency room visits and other things. But what was the feasibility of being able to have more of these established, and is that in the budget plan for the future?
It is not.
Okay.
Maybe Tammy can talk about some of the history of Cabrini House particularly, which used to be a board and care and then was transitioned into supportive housing. And that was supported in large part by the Mental Health Services Act. And that funding stream, particularly for that type of program, is gone.
Okay. So this is not normal MHSA funds that we're getting. I mean, I know it's divided up, but could an innovation portion go to something like this?
Absolutely, with through the stakeholder process, if the community want us to launch into an innovative project though, so
Yeah.
it couldn't be just launching another house as we currently have it. It would have to be something that we could prove to the state, to the oversight committee, that it's somehow innovative, is gonna save us money and possibly even be sustainable.
Okay. And Tammy, do you remember how long it took to be able to kind of go from the ideation to actually opening the doors?
Actually, when behavioral health transitioned from the county contracted provider to county-owned and operated, Cabrini House was already operational.
Okay.
So it was a matter of taking over the administration and the policies and procedures that effectively govern that site. So we could reference back to the transition documents to see if what kind of budget we began with and how that expanded or what changes occurred
Yeah,
since then.
I'd be very interested in learning a little more on that. Just looking at the adopted budget, of course, we have Visionary Homes as one project. It's 84 units. And it's just generally low-income housing. But these are folks with a very high level of need. What was the budget for it? 50 or 60,000?
48, would you say 48?
It's very easy to have some folks with this high level of need unmet in the community rack up that in a visit, I think, a hospital visit or whatever it is. So this is really, really inexpensive and good. And then I'd also love to know any efforts with, I believe it's the Stanislaus Housing Authority, right, is who we kind of contract through as a county, and future efforts that might be more housing oriented with behavioral health component. But outside the scope of today's meeting, thank you again for presenting on it.
Thank you.
All right, I think that wraps it up. Next up, we have social services.
Okay, is there any other questions or any public comment on behavioral health in general? Okay, thank you very much. Great job.
Are we taking a break? Are we taking a break? No, this one. Good morning, Rebecca Espino. Clay could not be here today, so I'm hoping her spirit will be with me because she does speak very passionately about her homeless work. So hopefully she's listening. The Homeless Advocate and Outreach Coordinator position was really created to bring public and nonprofit and private partners together to work on homeless issues. Clay was redeployed
pretty much as soon as she was hired, she was redeployed to help with COVID and to support the homeless community, placing them in, possibly hotels, providing tents, to, keep them safe from either being exposed to COVID or a safe place for them to quarantine or isolate if they did contract the virus. On April 6th of this year, your board created a homeless advisory committee, which was in line with your board goals, and Clay serves as staff for that committee. In addition, she participates in multi-level government housing forums to learn best practices, identify funding opportunities, and she also partners with local agencies who also serve our homeless. So some statistics. In the 18 short months since this position was created, a lot of great work has been done. Calais, with the support of many staff from the CAO's office and the Health and Human Services Department, allowed her to be instrumental in serving the homeless, especially those impacted by COVID. Calais helped coordinate about 2,200 bed nights for a total of 52 people. She coordinated over 2,300 hours of case management and coordinated testing and vaccination for mobile clinics at homeless encampments. Similar to other departments, she has met some challenges. The first one, to support the homeless, the first and the biggest challenge is low housing inventory. And that's just not just for the homeless, but for folks that like you and I who are looking for a place to live. Folks that have the resources are able to more quickly find housing, and they have good income, they have, good rental history, versus our homeless who maybe have unstable income, maybe poor or no rental history. So really when they're in competition for housing, that they frequently do not end up on top. Another huge challenge is the fidelity of Calais' position. It relies heavily on grant funding, and most grants limit administration costs to 10%, which then requires Calais to perform direct services, which is really not in line with the intention of this position. In addition, this position requires significant support from analysts and fiscal, which again further depletes the administrative fundings to support Calais' position. The most significant, in addition to the fidelity of Calais' position, the next huge challenge that the community really, and anybody who's serving the homeless, is facing is NIMBYism. Although homeless is a community issue, it has been difficult to find a location in the community to help move homeless from encampments to temporary or transitional housing. But there is good work that is happening. There is good news in the future. We look to overcome our challenges, and we believe the board's Homeless Advisory Committee will be instrumental. The committee is a well-rounded representation of community members, nonprofits, tribal, local governments, and schools, all dedicated to homeless issues. This contingency of partnerships is best positioned to make meaningful changes. We will also continue to search for administrative funding to maintain this position, including possibly seeking general fund. Thank you. Any questions on Calais Cost Center?
Just one quick one on the, sorry. On this little section of slides, can you please distribute that out to us? It had some good information in there that I don't want to try and write it all down.
Distribute them to?
This is all on the website.
Okay, I was just looking for this specific slide here. Okay.
I also get the pleasure of working a lot with Calais, and I wanted to, can we really quickly go back up to the organizational department for her? Homelessness is a top issue identified by this board. This might just be my personal opinion, but I think this county as leadership are really trying to take homelessness as an issue very, very seriously, and it needs to be, and it hasn't been as much as it could be for a long time. But all of that right now is resting on one singular person who's scrapping together grants to make sure that she can pay for her position. And if anybody is curious beyond just the numbers of the work she's doing and wants to know is she up to snuff, ask her about grants. And she'll go on for a little bit of all the ways that she's able to make these programs funded for the room key and that. I would be very interested as we're having our ARP discussions about what can be done related to the issues of homelessness, because there are a few pieces in there. One is potentially utilizing our emergency shelter ordinance and putting something aside for that. We also have the issues of the limitations of those grants. So for example, we get room key money to put people into a hotel. As we know, many homeless people, for security and for comfort purposes, have animals. It will not cover animal fees, and there's no fund for that. And so here we are with money sometimes and the capacity to put someone in a room to be able to get them off the street, and we can't because it's a $10 fee, an accumulation of that. So there are some other things that I wonder if this would be good use for the recovery funds. Beyond that, I appreciate all the work that she is doing, and I appreciate you taking this into your department as well, and the staff support that she has provided from everybody else. Because I know that this organizational chart has a lot of hidden boxes in there of all the support staff.
Yes.
And then lastly, to all the community partners, Kalea is coordinating much of that work, and I know she's out there probably working 60-hour weeks. But how she hits those numbers is she has a lot of community volunteers, a lot of community groups contracting through and working to provide these direct services. So we are finally taking this seriously. I agree, we got a really well-rounded fantastic homelessness committee group that I've just been so proud of recently, and both Supervisor Half and I sit on that. And I'm very excited about what we can do on this issue. And I completely agree, housing is probably the most challenging solution, especially as we look at our Emergency Shelter Act, because there is no inventory for us, for people with decent jobs and good credit. What is there available then for somebody who has any issue at all against them? They're effectively excluded from living here, and it's not right. So, thank you.
Thank you.
Okay. Is there any public
So
comment?
I do have a few comments.
Okay. Dive right in.
I think, Jaron, if we want to talk about using ARP funds for homeless, we need to have that discussion. When we had that discussion, it wasn't on there, so we're gonna have to bring it up again at the 13th. I'll just simply say, when it comes to the homeless, I'm not in favor of spending any general fund monies. There's a lot of granted monies out there. There's a lot of more money coming from the state. I think we need to make the best use of that. When we say that there are no other positions dealing with this issue, we have nonprofits, we have churches, we have ADCA. We do have people, and I don't think the county, I think the county should be part of the solution, but not the full lead on it. So we need to be using all of our resources the best we can, and that includes the community, which Kalea is doing a great job on. This is in no way a knock on Kalea. This is just a fact that there's a lot of granted monies out there, and we need to use those the most. And so I'll just leave it at that.
And I just wanted to clarify that I did have that in my requests. I printed that up. It was part of my spreadsheet. And I'd be interested, you mentioned you had one too, in seeing that and comparing it to see where there might be something we can work together on. So, thank you.
Okay. And I'm going to try and keep us away from a policy debate here. We are in a budget study session, so if we could kind of focus on listening and learning to what our departments have to say about their budgets, then I think we'll be able to make these kind of policy decisions at a later time when it's agendized for that. So I'll look and see, is there any public comment? Okay. Thank you very much.
Okay. We're gonna finish with our final presentation, Department of Social Services. And similar to the other Health and Human Services departments, our programs are vast and our challenges are similar. To do our work, we have 112.5 full-time employees and numerous part-time employees, and a $29.5 million budget to administer mandated federal and state safety net programs, employment programs, and protective services programs. In addition, we are fully dedicated in prevention services, which are primarily funded through competitive grants. So just a high-level overview of a few of our programs. I won't go through every one of them, but just a few. Our safety net programs, our cash assistance program, also known as CalWorks, assists families with dependent children. Our medical assistance programs, which are Medi-Cal, County Medical Services Program, and the Affordable Care Act, are obviously services for those seeking medical coverage. Our food assistance program, also known as CalFresh, serves families and single adults. Our employment and training programs provide food and cash assistance recipients the opportunity to participate in job skills programs and on-the-job training to increase their markability, creates a path to increase earning potential, and eventually self-sufficiency. Our children's system of care services focus on supporting children and youth at risk of harm, supports family reunification, and an important component is early intervention, again, which is unfortunately funded primarily with time-limited grant funds. Our adult system of care serves at-risk elderly and dependent adults. Our IHSS program assists eligible aged, blind, or disabled individuals receive necessary services so they can stay in their home instead of being placed in a long-term care facility. Our extended foster care program creates a path for foster youth to remain in foster care until the age of 21. And this was really designed to mitigate homelessness of our youth. So as youth transitioned out of foster care at the age of 18, studies showed that they immediately became homeless. So this program was to support them through the age of 21. And in addition, these youth are provided self-sufficiency skills and supports through another program called the Independent Living Program. Our general services unit, our general services and administration unit, they are the backbone of our department, and this unit operates at an optimal level. This unit is responsible for a plethora of tasks that serve not only social services, but all health and human services departments. They do grant writing, quality improvement monitoring, budget trend analysis, capital improvement, project management, and our support staff who serve as our initial point of contact for the department. And those are just to name a few of the tasks that are assigned to this unit. Wendy will share our statistics and some accomplishments.
Okay. So the Health and Human Services Agency continues to look for grant funding opportunities to enhance our revenues and to provide the needed services in our community. The Department of Social Services has brought in over $500,000 in grant revenue in the last fiscal year. Aggressively pursuing competitive grants that allows the department to expand services related to the safety net programs and builds on our philosophy to invest in prevention programs. Usually grant revenue does not provide adequate funding for administrative cost, but we continue to persevere since the impact to the community is far-reaching. Our statistics and lists of achievements are vast, so I'm only going to pick a few to highlight. Our public assistance unit received and processed over 6,000 applications for assistance. The Children's System of Care received 734 reports of child abuse and neglect. All reports are reviewed by a team of social workers to determine if further investigation is required. After this analysis, it was determined that almost 50% required more investigations. The adoptions program was brought in-house during the fiscal year 2021 and became fully operational on January 1st of 2021. So far, 4 adoptions have been completed and the unit is serving approximately 60 prospective adoptive children. And the General Services Administration Unit has been a driving force to facilitate millions of dollars in grant funding, and most of these funds are multi-year funding sources. As an example, social services and many county departments have benefited from the procurement and establishment of a contractual relationship with a vendor using federal 4E funds to provide high-quality training for CWS services.
So now we're gonna talk a little bit about our challenges. The common theme you heard today is our struggle to recruit and retain staff, and unfortunately DSS is not immune from that challenge. The impacts of our inability to recruit and retain social workers is far-reaching. Currently, 34% of our workforce is either vacant or has less than 1 year of experience. Our social workers serve in many capacities. Some are dedicated to serving families who have significant barriers to employment, such as domestic violence, substance use, and mental illness. Some focus on assessing homes and families for foster children whose parents have lost their parental rights. Some are dedicated to serving vulnerable adults. And some are dedicated to protecting our children. Daily, child welfare social workers and their supervisors see, hear, and attempt to process the most heinous acts on children, while at the same time they are mandated to work with and support parents to reunify with these children. Research shows children assigned to multiple social workers are less likely to reunify with parents and spend more time in foster care than children that have only experienced one social worker. A foster child who has one social worker has a 74% chance of finding a permanent and stable home. That percentage plummets to 17% if the child has 2 social workers within a year, and dips to a devastating 5% when they have 3 social workers within a year. As I mentioned earlier, the impacts of our inability to recruit and retain social workers is far-reaching. The eligibility position is another classification that experiences a low retention rate. Currently, 39% of the workforce is vacant or has less than 1 year of experience. This classification retains the sole responsibility to determine initial and continuing eligibility for numerous public assistance programs. The skill sets and the longevity needed to perform at an optimal level is plagued by a pay structure that has historically been benchmarked as an entry-level position, which is substantially inaccurate based on the complex work required by this classification.
I was gonna ask, so it's 34% of our positions across social services are vacant, is that correct?
So 34%, when we go back to the social workers, 34% of our social worker positions are either vacant or have less than 1 year of
Okay, so
experience.
that's social workers, and
And
then
then
the 39% is,
Eligibility workers are either
Eligibility,
vacant
okay.
or less, or have less than 1 year of experience.
okay. You don't have any statistics that would just kind of show the entire social services network, what's that picture? Do you have an idea?
For the entire Department of Social
Would
Services?
it would be probably in the 30% range for across all social services, I guess,
Well,
or more.
well, we don't have a vacancy problem with our office assistants.
Okay.
So not every position
So-
is at
so
this
it's-
level. It's specific to our social workers and our eligibility
Okay,
specialists.
that's what I was trying to understand. It's specific to those people
Yeah.
that are the real public face of
Right.
social services that are the ones, getting in there with the child welfare situations that are really heartbreaking, and working with people who are eligible for public assistance, that type of thing. That's where we're seeing a reduction in people wanting to apply for these positions.
But I have to say that our social workers and our eligibility staff do not work in silos, and there is many supports that are around them. So they are equally important to the organization. And even though it's not on my presentation, at this point, I do need to put in a plug-in for our office assistants. They're the face of our agency, and they make minimum wage. So if there's an opportunity for that to be changed, that would be amazing. But again, I'm focusing on the two classifications where we struggle with recruitment and retention. Okay, so again,
Hey, Rebecca, can I ask you a quick question?
Yes.
So this kind of has to do with what Supervisor Campbell was bringing up. You know, when we were having the ARP discussions, I talked about critical positions. So when somebody calls 911, the sheriff shows up. And then in my mind, you know, there's positions like the jail and the juvenile hall where we have to have staff. They're mandated to be in those positions because of ratios and whatnot. After the critical staff where it's life-saving personnel, in my mind, the next most critical position is anything that touches a child. Is there any way in the future, and I know you're busy, but that you can go through your organization? I know everybody in your organization touches a child, but those critical positions where it's not life-saving, but it's the face of people who are dealing with those children, and you know, where we're having 2, 3, 4 social workers flip over in a year, and then you get those horrible statistics. Can you, in the course of time, maybe kind of, and you don't have to necessarily, you know, share that with all your staff, but I would just like to kind of get an idea of the most critical within the organization. I know they all are critical, but that's what I'm looking at.
Okay. I will get that for you.
Does that make sense?
Yes, I will get that for you.
And Supervisor Kirk, I just wanted to chime in a little bit. Some of those positions, the social worker positions, especially the emergency response, are life-saving in some cases. So I have a hard time hearing that from you. So I just wanted to make that clear.
No, I hear you, and let me clarify, because I used to be a probation officer where I've actually seen probation staff probably intervene in situations that probably save lives. So I completely agree with you. So maybe my explanation wasn't clear. I'm just, in the back of my mind, I'm trying to categorize and get an understanding of critical. They're all critical, we understand that, but Rebecca knows her organization, so I kind of want to get it from her and be able to look at those numbers for the future.
Just to chime in, if it's a private conversation, I think that's totally fine. I would be opposed to the idea of lining up HHSA staff and saying these are the most critical, important ones, and these are not. Because I think that can have a really negative impact on morale. And even if they're not client-facing, they are, as Rebecca mentioned, supported by a wide range of other staff. And so it's very hard to do that, and I don't think it's really a productive process.
Okay, again, I'm going to advise
Well, then
our
you cannot be a
supervisors
part of the conversation
that we're in a budget study session and we're entering the realm of providing direction to staff. And so if we could keep it to questions, gaining information, listening, and communicating. And if you want to have those conversations with department heads, you're welcome to do that. But I think this is not the setting for that, so.
Okay, I will continue. I'm still speaking on the eligibility specialists. The rules and regulations for each of our public assistance programs are diverse and frequently change. The time-sensitive and complex tasks must be completed in very short timeframes. Some of those timeframes are as short as 24 hours. The work must be accurate to ensure that taxpayer dollars are efficiently managed. So what that means in short is they must do it fast and they must do it right. The data collection strategies they must use to obtain information to determine accurate benefits must include a balanced approach of gathering facts through motivational interviewing, sometimes extracting elusive information, but while at the same time ensuring that the dignity of those seeking assistance is always, always at the forefront. Again, the inability to retain eligibility specialists directly impact the timeliness of processing benefits. When benefits are delayed, rent goes unpaid, medical care is delayed, and families may need to wait to properly feed their children. Again, the impacts are far-reaching. So besides recruitment and retention challenges, our next area of concern is the explosive high cost of our foster care and adoption programs, which is not keeping in pace with our funding. As an example, between fiscal year 1920 and 2021, the cost for our foster care and adoption programs rose close to $344,000, and we are estimating that this upcoming fiscal year, the cost will increase to over an additional $800,000. The problem lies is the funding that supports these placement costs are the same funds that we must use to pay the salary of our social workers, which means when we have high needs in our foster care, we have less money to pay our staff, which is ridiculous, but that is how the funding mechanism is in place. So the more need, the less staff we have. The last challenge I will share provides me just another opportunity to really put in the plug for assistance for our TGH relocation to join our sister department of behavioral health. Spending almost $500,000 in lease payments for 2 privately owned buildings is a waste of taxpayer dollars. We are not asking for a handout, we're asking for a jump start. We could use these funds, these lease payment funds, to support labor negotiations and to bring fidelity to grant-funded programs that focus on prevention services. We must be proactive in our approach to serving our community instead of being reactive. We want to help children while they're still in their homes instead of after they have been traumatized beyond repair. So on that bright note, I would like to focus on what we planned for the future. We plan to fully operationalize the high-performance organization philosophy by encouraging leaders at all levels. 100% of our DSS leadership team participated in your board-supported high-performance organization training, and the fruits of that investment have been immediate. Employees from all levels of our organization have joined numerous committees to help the Health and Human Services Agency support board goals, which includes, but is not limited to, recruitment and retention strategies. We are not looking in these committees for financial changes. We are looking for non-financial changes, such as creating recruitment flyers, announcements, and videos, identifying methods to build resiliency in our workforce, increase a healthy work environment, conduct stay and exit interviews, and use that data from these interviews to quickly respond to areas that need improvement and to build on what we're doing well. As mentioned earlier, the high cost of foster care placements requires us to come up with creative solutions locally. Michelle Clark, our Children's System of Care Deputy Director, is seriously pursuing the viability of building a local intensive services foster care program to support high-needs children locally. But this will require a Health and Human Services integrated approach to serving children. This will require Department of Social Services, Behavioral Health, and Public Health to work together in partnership, integration, collaboration. In closing, we have been blessed with grant writers who have helped us secure many competitive grants, some as high as $1 million. We plan to continue to invest in high-level grant writing personnel to identify and pursue funds to not only support existing programs, but to create fidelity in existing grant-funded prevention programs. Thank you.
Thank you very much for your thorough overview. Are there questions, final thoughts on this department?
Yeah, I was just curious. It went by pretty fast, and you may have said, and I'm sorry if I didn't catch it, regarding your APS, Adult Protective Services social workers or worker. I don't know. In the past, there was only one. because there was no funding for it, and I noticed there were 585 referrals for the past year. What's the status of that? Do we have more than one individual working in this? Has anything changed, and is there anything on the horizon? We're a gray county, as you are well aware, one of the top 3 in the state. So this is a concern. Of course, the children are a concern. But typically, in the past, there has been no funding for the adults, especially the elderly, that are being taken advantage of. So I'd like to hear a little bit more about what you're doing there.
Supervisor Half, I snicker only because there's still just one. But we do have some relief employees that are supporting that program. We do have quite a bit of cross-training that's happening in that program. And I think for the very first time in many years, we see that there is going to be an investment in APS by the state level. So we're hoping that that funding will help us expand that area. But yeah, we have about one.
Well, sounds like there's something good on the horizon. I'm very happy to hear that. Thank you.
Yeah, thank you again for being here. I just want to draw out to some of the stats there that you presented. I think it's just a little bit above this. Tuolumne County, we have not only, I think, about 80% more elder abuse than a lot of the state average, but it also goes for child abuse as well. And I really appreciate that these are the folks people are calling when they need to do welfare checks to make sure that children are not getting abused. And that's such an important part in the safety of families here. So thank you for all that work and everybody that supports them. I also just wanted to, I've shouted out the other departments too, but we had a recent thing, I think Behavioral Health Advisory Board. We're looking at what more legislative actions are happening that this board, through that advisory board, can maybe take a position on to be able to support. And I'd say the same to social services and the rest of the department. If there's something going on and you're really going to be a lot better informed about it than we are in all the kind of state and federal updates, please bring it to us. If that space doesn't exist, bring it directly to us. Because I think we want to advocate to get you everything that we can with that. And I appreciate the frankness with the issues, but also a lot of, I think, very good direction of where the department is going overall and specific to this. So thank you.
Yeah, just kind of echoing on here, a lot of different areas, a lot of areas of need, and having enough staff, enough budget to cover all those needs is problematic. I too echo on the adult protective services. That's again, with our county, with the large number of people that are aging and continuing. I think those numbers are actually going up. Foster care, to me is something that it looks like you've had very good success, with those, returning children. The stats that I'm seeing. But the escalating costs are certainly there, and we need to figure out how we're gonna approach that as well. But many different areas here. Thank everybody for all the work that they're doing. Not just social services, across all of your program areas, Rebecca. You're just doing a really good job, and appreciate it. Thanks.
So I think
And Rebecca, they've all said great things, and I'll just say thank you. When Steve Boyack says words like that about you, when he was in the bid for the job, you're doing a great job. So you have a great team, and I appreciate all you do.
Thank you. I'm not alone. I have a whole team. We have one more. It's the Welfare and Securities Cost Center. Super short. Steve.
Okay, so the Social Services Fund is made up of 2 cost centers. We have an administration cost center, and we have something called the Welfare and Securities Cost Center. I'm speaking to the welfare and security side of our ledger. And our Welfare and Securities Cost Center is always built with a net cost. We know that there is not enough revenue to cover the costs in this cost center And this cost center is primarily used to cover cash assistance payments through CalWORKs, foster care costs, and adoption assistance costs. Rebecca spoke in detail about what those costs look like and our challenges to cover those costs. So this cost center is built, we had the recommended budget come before your board. This cost center is built with a $4 million net cost. I can't tout that enough. $4 million. That means that we have to balance that net cost with the administration side of the fund. Rebecca spoke exclusively about how we balance that. We balance that with discretionary realignment funding that comes to the Department of Social Services. Discretionary is the key there. Rebecca did speak to the fact that there is competition for the dollar. Every dollar that goes to pay for placements is a dollar that does not go to pay for staff to try to either manage the placement or build program to attack why a placement is occurring. So being proactive in our programming development. So Rebecca did speak to the fact that we are keenly aware of this level of budget risk and being able to manage this level of budget risk moving forward. We have great creative minds that are in this room that are building programming today, so I want your board to know that we're not sitting on our hands. We know this is a challenge, and we're going to build programming around trying to attack this challenge for us, because it's, I'm not going to say it's unsustainable, but it is a challenge, and costs continue to rise, and we have to develop a level of program to ensure that we are being proactive in our ability to attack this challenge when we're paying for foster care expenses and adoption assistance expenses. So we are in the process of integrating our agency, and I think integrating our agency is critical considering this level of budget and program risk. We need behavioral health staff to help us with this. We need public health staff to help us with this. As your board knows, we have already in the past embedded behavioral health staff in our child welfare unit and have specifically addressed a level of caseload need, our highest level of caseload need for a social worker and a behavioral health clinician to manage that caseload, because we know how risky it is, both for the individuals that are in placement and, of course, our budget risk. So we will continue to look at our program. We will continue to build proactive programming around this budget risk, and integration is going to allow us more opportunity to do so. So I'll be happy to answer any questions.
So, thank you very much for going over all this, and particularly, I don't think people understand how expensive these services are and how much oversight there is, and how that impacts the amount, what percentage of on the dollar actually goes to providing those services is much smaller than I think people expect, because there's a great deal of oversight, there's a great deal of work that goes into every dollar you spend that actually improves the lives of our citizens. And so it's an extremely frustrating process when you're just out there trying to do good and you have to answer for everything you're doing. And you have to pull people away from projects that might actually be improving people's lives to do paperwork. And I remember that was the thing that always frustrated me the most. and so it's almost doubly frustrating. A career to be in is health and human services related, because on the one side you're dealing with this enormous bureaucracy of federal and state regulations, And on the other hand, you're dealing with people that are at their, the deepest depths of the worst moments of their lives in many cases. And you're there to pick them up and bring them back to where they can be, I don't necessarily want to say happy, but, you know, productive members of society and have lives of their own. And so it's so often a thankless job. You know, every run from clinicians to social workers to eligibility, and then the people that are supporting them, whether it's clerical or cleaning the bathrooms. You know, somebody has to do all that work, because if they don't, then we end up with people on the street, homeless and broken with nothing else to do. And so really, from the bottom of my heart, thank you very much for the work you do and for being so responsible with your budget, which is kind of, that's our wheelhouse. And that's what we're here to talk about. But behind the budget and behind where this money goes is people. And so the fact that you never lose sight of that is really gratifying. And I think you've all done a phenomenal job.
All right, thank you.
Just real quick, is there any public comment on any of these HHSA-related items? We'll give one more shot to folks.
Well, I'm not up on all the data, but it seems to me their vacancy rate is a lot higher than the vacancy rate I've had to hear about through 3 very long, lengthy meetings with one particular department. And I wish you kind of had a little dog and pony show, because I didn't know who Damien Renault was. Sorry to hear his story of being in foster care. And then to hear Pam Orbaugh's story of being in foster care. And they are 2 outstanding members of our community. And so many people fill this room wanting to put money into the care and feeding of of criminals, you know, and at least 37% or something of our budget goes towards the care and feeding and prosecution and whatever of criminals. And this money changes lives.
All right, thank you very much. Okay, we'll close public comment, and then we'll take a 10-minute break. We'll reconvene at 11:12. Thank you very much. Welcome back to the meeting of the Tuolumne County Board of Supervisors. We're doing a budget study session. We just heard from Health and Human Services, and we have Kim McFarland and Blossom Scott Heim from Public Works here today. Good afternoon, or good morning.
Good morning. Thank you very much. So it sounds like we're going to be splitting this up a little bit. We are going to give you an overview. This is our organizational chart for Public Works. As you guys know, we have multiple divisions, and we'll be covering airports first. But before we get into that, I just want to say, you know, our goal at Public Works is to provide exceptional services to our community and visitors, ensuring Tuolumne County is a desirable location for future generations. And we really believe that. And we do that every day by fulfilling our mission, which is that we will be reliable, responsive, and resourceful. So in general, despite our staff shortages and the challenges of COVID this year, we really strive to provide the best possible customer service to all of you and the public. And I think that's a good example is when you call our main line, you should reach a live person. And if you don't, because we're busy with someone at the counter, we are pretty good about returning our phone calls and emails. So thank you. All right, so with that, we will start on with airports. And just in the interest of time, we're going to just show the story for Columbia, but we do cover both Pine Mountain Lake and Columbia airports. So this airport division is responsible for 3 runways at the 2 different airports, one of them being grass, which is a big deal. It's a small group of 1 airport manager, 1 admin assistant, and 2 airport techs. Unfortunately, we are short both our airport techs right now, one due to an injury and one because we lost him to a better paying position in the private sector. But we did interview some really great candidates, and we're in the midst of replacing our person.
Sorry, who did we lose to the private sector?
We lost Tyler Stoy, our senior
I didn't
airport
hear,
tech.
I'm sorry.
What's that?
We lost who?
Tyler Stoy.
Oh, okay.
Yeah.
I didn't know about that.
Yeah. Well, now everybody knows.
Sorry. Well, I didn't mean I didn't mean you had to say the name. I didn't hear
okay.
the position that we lost.
All right.
Okay.
So the Columbia Airport operates with a $750,000 budget and about $100,000 for Pine Mountain Lake. Some of our recent departmental accomplishments this past year include making good use of the Federal CARES Act money, and that was, we did a runway and taxiway crack sealing at Pine Mountain Lake using our road crews and reimbursing the road fund. We also accomplished a obstruction survey. And then in Columbia, we finished the taxi lane restriping, and there were some really great campground renovations completed out there in-house. So a new roof, all the washrooms, the bathrooms were redone. And then also at Columbia, the aircraft parking apron flood lighting renovation. So the top departmental concerns for the airports is, as usual, is trying to find funding for airport improvements and what funding mechanisms are out there. Addressing the runway issues at both Columbia and Pine Mountain Lake. So regarding Pine Mountain Lake, we do need to review the issues around the residential through the fence, or what we call RTTF, and uncontrolled access, which will involve a much deeper conversation with the CAO and board. Because of this issue, Pine Mountain Lake is ineligible to receive FAA Airport Improvement Program grants. And then another concern is pursuing revenue-generating opportunities. We really think that both airports have great opportunities to attract more visitors to the county, but also be more financially viable. And we did bring recently some ideas to the board, such as building new hangars, tie-downs, investing in the existing infrastructure, updating signage, and creating more events that will draw more folks to the area. And that is it for airports. If you guys have any questions, and then if we have time, we can move on to Public Works Admin or wait until after your closed session.
Well, we've got 10 minutes. Is there any questions for airport?
Okay.
Yeah.
Okay.
Just one quick question. One thing that has come up to me, actually from both Jamestown and Columbia, has been the idea of using Columbia Airport to try and generate more revenue for potential events and other activities as well. And I wanted to see, as far as revenue generation, because I know we've identified, obviously the tarping. I think having more facilities there to how, renting hangars. What have been the options for that? Is that something that's still viable? Is there something that the board can do to facilitate that?
Well, we need an initial investment. I think that Blossom did a great job of identifying during the, I can't remember what board meeting that was, but I think the investment was something like $15,000 for a solar-powered canvas tie-down. And then that's, I think, $750,000 for the real hangars. We have 30 people on a wait list for hangars. And we did hear that from a lot of the tenants, is that they have been waiting for years to get into a hangar. So I think if, obviously the return on investment would be years, because you can't charge an exorbitant amount, but even charging a realistic amount, we could see a return on investment in 10 to 12 years.
Sure. What I hear specifically is about the idea, I believe in the past it has been used for, I think, a runway as a racetrack at different points where they've been able to do, I know it sounds kind of silly, but like a short drag race. There is a little community here of that. We have the Father's Day fly-in and some events there. And I've wondered if that's an area for revenue expansion for alternative non-airport related events that can be expanded if there's potential.
So the Father's Day fly-in is still a really popular event. It's just has been canceled the last 2 years due to COVID. But yeah, Benny, our airport manager, who unfortunately is off this week, couldn't be here, but he has lots of ideas to bring in. I didn't know anything about the drag racing though.
There was a rumor at least, but I'll try and get some more info for you. Thank you.
Yeah,
I can tell you there was a drag race between, I forget what kind of a car and a plane. And this was at one of the Father's Day fly-ins a long time ago.
It's funny, I keyed on the same thing too. I was like, hey, who's doing drag racing? I'd like to see that.
So for that, I will just add, there are some FAA regulations out there that do limit what kind of activity can take place at the airport. So those are some of the things we do have to work around, but we're always open to some ideas.
Jet cars? Is that okay?
I'm not sure about drag racing. I know it would be,
They did, no.
could cause some wear and tear on the runway.
Kathleen's right.
Racing cars.
They would race a car with an airplane. on the, yeah. No. Maybe we'll just not mention it to the FAA.
All right. Okay, so moving on then to Public Works Administration. And we'll just wait till, all right, Blossom, you want to scroll down? So the Public Works Admin team is basically all of your engineering and divisions that support engineering and roads, such as our fiscal team. We have 15 allocated positions with 13 currently filled. These are the folks who oversee all road capital projects, pavement inspections, traffic engineering, such as your speed studies, the accident data, regulatory signs, asset management, such as bridge, culvert, and sign inventories, and they're the ones that make the recommendations on hazardous road conditions. Additionally, this group issues permits for utilities, transportation, grading, and encroachments, and special events. So whenever a special event, such as a street fair or a market, actually requires the closure of a county-maintained road, they have to come through us. And it's actually a lot of work for our staff. We ensure that there is a public meeting with all emergency personnel to make sure the detour is set up correctly and safely. We make sure that there's the appropriate insurance. And oftentimes, these folks are not really well-versed in what is a safe setup, so we have to sort of guide them through it. And just so you all know, if it's an actual nonprofit, we do this by waiving the fees. So it's a lot of work, but no revenue coming in, so. Recent departmental accomplishments. There's our org chart. Well, we don't really have a lot up there for pictures. We have a lot of pictures under the public projects, so we'll just stay here. We have really made an effort to get more information out to the public via social media, which we hope is better educating the public on our limitations and accomplishments. And as I already mentioned earlier during the intro, we hope that we've been improving our customer service. So, our top departmental concerns are always funding. We've presented on this before. Expenses continue to rise, but the revenues remain stagnant. Not that they were ever enough in the first place, but we do try to minimize the deterioration of our roads. Our engineers are very accomplished grant writers, and without them, we would not get our bridges and major road construction projects financed. So the work that they do is actually outside of the SB1 and HUDA money. That's like our capital projects, which Blossom will report out on after lunch. So yeah, they're great grant writers, and they're also masters in contract management, which is really a necessity when you're dealing with the state and federal requirements for these projects. Like the rest of Public Works, attracting skilled, qualified talent, specifically engineers qualified to obtain professional licensure, which is currently a requirement for the Engineer 3 position and Blossom's position. And I've been speaking with our private sector colleagues. You know, qualified engineers are in short supply across the state. So it's particularly challenging to attract entry-level engineers here to the county, especially when you're competing with the Valley and the Bay Area and all that they offer culturally. For instance, our last hire came here from Mississippi. So he's doing great, but we had to hire from that far. Public outreach, we're getting the public educated on where the funds are coming from and what we have and what we can do with them. And I think, is somebody saying something or? Okay. So I think we're doing a better job, but we have a lot more room to grow there with public outreach. So looking forward, we hope to improve our employee retention. We've been working to create a better workplace culture and provide flexibility for staff with flex schedules and training so that these new and mid-career employees can continue to advance. It's really important with engineers trying to get licensed. They need to have the opportunity to train and have a licensed engineer overseeing them. With the $1 trillion federal infrastructure plan in progress, there will be funds to provide electric vehicle charging infrastructure and hopefully set-asides for improved mobility. We have already started improving the permitting process under Blossom's oversight, and it will continue to improve with the OpenGov software. And this last bullet up here, we know that we need to get a bit tougher on enforcement of our ordinance code. It's just, that's the way it has always been in the past. And, you know, those who choose to ignore the ordinance code, for instance, tearing down illegally placed signs that pose safety issues in our road right-of-way and removing garbage and graffiti are really a waste of resources. So we will be working with County Council and all of you to tighten up our ordinance code. And I think that's all of it for Public Works Admin right now.
Thank you much.
Just one comment. The roads report that you put out every week, that is wonderful. I mean, it is really helpful for me. I'm sure it is for the other supervisors as well. Just a lot of good information there and across all of our districts. And do you give that wider distribution? Where does that, I'm just curious, I mean, because it is a lot of value to that.
So we just provide the photos and some captions to social media, which is Facebook, Instagram, and Twitter. But yeah, we don't usually provide all the actual road names of everything that you guys see. I don't know that everybody would read that. So
I'm not sure either, but, you know,
Yeah.
I mean, there is a lot of value to
Okay.
it that I see. And I don't know if this is the appropriate place. We'd had discussions a couple of times, and I always forget the name of the process, but that experimental, at least to us, of what was being used in Watsonville and Lompoc, and looking at that, you know, just wondering about the temperature extremes up here. Did we do any more research? You know, did we find out anybody else doing that? And what would be the cost to try it out? Could we do a smaller section maybe that not as high cost? So go ahead.
Sure. So we're calling that a demonstration project because obviously it's the first time we're trying it. It's a triple Cape seal. And we are just starting to develop that project now. We had it in this year's budget, so we didn't start working on it until July, of course. But we're just developing the plans and specifications for that and working through kind of pinpointing those temperature ranges.
Yeah.
And then the cost, we're about $330,000 for 1.25 miles, so I don't have a calculator in front of me. It's a little over $250,000 a mile.
Okay, well, from what I saw from when you initially brought this to our attention, it was roughly a third of the cost of some of the traditional methods we were using. So
Yes.
I'd sure like to get that going and try it out because that has implications where it could save a lot of money if it's successful.
Yeah, we're hoping to have that out to bid in about 6 weeks.
Excellent, thank you.
Well, I think, are we okay? If we have other questions, we can probably. Well, I think, are we okay going a couple minutes past 11:30? We do have a closed session we need to get into.
Yes, so with the appointments, you can always go later, you just can't go sooner, so you can finish your item and then we can get to it.
So let's go ahead and finish up on this element of Public Works, and then we'll invite them back after 1:30.
Okay, well,
Okay.
I did have something I wanted to say. I'm really glad to hear about strengthening up the ordinance code. Couldn't come sooner, so thank you for that. You probably heard me saying yay over here. The question I have, you talked about waiving fees for nonprofits for their events on the roads and that kind of thing. And I know this board is looking at space rentals, some of our community spaces, and possibly, we haven't decided yet, but it's going to come back to our board to decide on whether we're going to charge a minimal charge for nonprofits as well. So that may be, in order to keep things similarly aligned, that may be something that the roads would be looking at too, if it becomes part of what the board would like you to look at. I'm just speaking for myself right now. It sent a little alert in my head.
Yeah, if the board supported it, we would do that.
Okay.
Great. Wanted to echo the early thing on communication. I think you have been doing a really good job in communicating it to people. I see a lot of comments on there, questions getting answered, all the work that you're doing. And so that's been really, I think, exemplary in the county. So really well done with that. Equally excited about compliance and I think full speed ahead and no mercy for litterers at all in the county. Because we can't just keep dealing with these issues after the fact. It's so much more expensive and it's ugly during the time. So, and the permit center as well. Do we have a cost estimate? Now, as I understand, that's part of the website redesign. It's putting everything digitized. It's kind of a part of other processes like IT as well. Do we know when that might be implemented and what the setup cost might be? And is it budgeted for, those three?
I'm sorry, I missed the first part of that. You were looking for the cost on which part?
So adding in a digital permit center for the county, including for Public Works, and how much that would cost, and is it already budgeted for?
I don't believe we have it currently budgeted. It's something we could look at, and it could also be something that we do in conjunction with any scanning or document management program we do as well.
Okay, I think this is definitely in line with modernizing government and making it a lot easier, and Tuolumne County is easy to do business in as possible, so
Right.
would love to get those numbers. And then on the minimum Cape Seal, kind of in line with what Supervisor Goldenberg said, it is a very interesting concept. It's something I think we could apply very widely here, and obviously this doesn't quite go into the whole PCI report, but it's a pretty difficult situation we're in with roads, and no matter how much work we kind of do. But boy, if we knew 1/4 as much, that's a pretty good deal. Is the minimum to try out that idea 335 in any viable way, or is there a smaller section that can be done?
Obviously, the more square footage, the more square yardage we put into a contract, the better prices we get. The project that we chose as our demonstration project is 1.25 miles. We're gonna package up a couple of other smaller, similar treatment types with it of some other stuff we need to catch, some county service area roads and a little repair on Priest Coulterville from the mock fire. So while we could do a smaller segment, the cost could come in higher.
Okay, that's what I'm wondering, if we ended up doing, instead of 1.25 miles, we did half a mile, would it be 40% of the cost, or would it be 90% of the cost?
That's hard to say. It would not be, it wouldn't be 40% of the cost, yeah.
Okay, well, definitely interested in that, and thank you.
Supervisor Brandon, I believe I misunderstood your question. I believe you're asking about online permitting process for Public Works. Is that what you're asking about?
Yeah, I
Yeah,
believe
so-
the permit center with IT was kind of discussed, and it seems like this would be, I think, right, at the
So-
same concept.
Right, so through OpenGov right now, we are developing the online permitting system where people can do those things from home or remote location. That is in the budget and that is underway, and we're kind of coordinating that also with the go-live date with our new ERP system as well, so that way people can make their payments online as well.
All great news. Good news all around. Thank you.
Hey, Eric, will that be public facing also, where the public can see at any one given time where they're at in the system?
Correct, so they'll be able to log in and see where their permit is in the system and the workflow that's going on.
And we can use that for other departments like CDD?
Yeah, and actually, so CDD is currently we're getting really close to going live with them. And it can be used in any department that does right now, if you go in and fill out paper form, we can convert it to a digital process through that software that we've already acquired.
Great, glad to hear that.
Waiting to see if anyone else. Okay, yeah, and I agree with what everyone else has said. We're really excited about the Cape Seal project. I know, you know, as soon as we were talking about that, we kind of just ran with it, and I really appreciate that. And I think it's going to be a really good thing for the community. And then I also wanted to agree with what Supervisors Brandon and Goldenberg said about the communication. I think it's such a valuable tool for me, because when people say, you know, county's not doing anything for roads, I can say, hey, here's a list. This happened right in front of your house. I've actually had that happen a number of times.
It's so
And
good they
then,
didn't
and
notice
the
it.
response would be like, oh, yeah, well, they did do that. And, well, okay, you're welcome.
Yeah.
And so it's, you know, I think it's starting to push through. I think we're getting an impression in the community that no one's ever going to be happy, you know, with the state of the roads and infrastructure, because there's always ways we can improve. But I think it's getting through that we are doing work, that things are getting better, and people are starting to see it and notice. And that's really impressive, because, you know, as Americans, I think one of our, or at least Californians, one of our favorite pastimes is complaining about the roads. So we're breaking that bit by bit in Tuolumne County. So thank you very much.
You're welcome.
Were there any other questions from the board? Otherwise, I'll ask if there's any public comment. All right, any public comment?
There we go. I hear an awful lot of comments over and over and over and over and over again about the condition of our roads. And I'm just amazed at the amount of public that's here today when the roads budget is being discussed as opposed to some other meetings. Because I haven't seen anybody coming before you for months on end to talk about the plethora of crime in our community, but they have come to talk about the roads. So I just want to salute these two women because you are just so amazing at the changes that you have made in that department. And I don't ask for a lot, I don't think, but when I've asked you to talk to me, you are like right on it. You know, and you answer people's questions and you're very open about things. And I really like the way that you think outside the box. And we're getting things done.
Thank you.
Thank you. Okay, so you're going to be back, but we have an 11:30 closed session, and so we'll break for that. We'll return at 1:30, and before we do, I'll look to Ms. Ryan. Could you please read our 11:30 appointment?
11:30 a.m. Closed session conference with labor negotiators Tracy Riggs, County Administrator, Eric Earhart, Assistant County Administrator, and Ann Fremd, Human Resources Director. Authority Government Code Section 54957.6, all bargaining units.
And then is there any public comment on our 11:30 appointment? Okay, I don't believe we do have any. Do we expect a report out? Okay, no report out. All right, thank you very much, everyone. We'll be back here at 1:30. Thank you. All right, welcome back to the meeting of the Tuolumne County Board of Supervisors. So this is our second in a series of budget study sessions. When we left off, Public Works was going over all of their fine programs, and so we're going to allow them to continue with their presentation. Kim, are you ready to take it from there?
We're ready. So Kim McFarland, Director of Public Works, and with me co-presenting is Blossom Scott Heim, Supervising Engineer, and we'll also have Jim McCargue, the Director of Solid Waste. He'll come up and speak for Solid Waste. And we also have some of our managers in the audience right now, Mike Young from Fleet Services, Warren Smith, our County Surveyor, and Madeline Amlin, who is our new GIS Coordinator. Did I miss anyone? I think we're good. Okay, so here we go. Road maintenance, everyone's favorite topic. This is the group that keeps the roads open and maintains them with a shoestring budget. I always say it's easy to have great roads when you have limitless resources, but our road superintendent, Mike Cagnetti, who is actually out paving right now with the crews, he and his entire team get so much done considering the shortages. And this is the org chart for roads, which is on the OpenGov stories. Road operations consists of 3 road crews, west, east, and south, and a construction services crew. They're responsible for 610 miles of county road maintenance, which includes snow plowing, drainage, brushing, hazardous trees in the road right-of-way, pothole patching, culvert clearing, sign maintenance, guardrail repairs, graffiti removal, vegetation spraying, just to name a few. Our recent departmental accomplishments, we just took a clip from some of the weekly reports that you guys all receive and that we try to put out on Facebook, Instagram, and Twitter. But really, the roads are endless on what they've done for brushing and ditching. And then our vegetation roadside spraying program, it took a hiatus for a little bit, but we have it back in place, and we're always trying to improve it's a balance between the really good chemicals that kill everything and also having less of an impact on the environment. And just recently, the road crews performed a less than 1-inch maintenance overlay on Standard and Old Wards Ferry, and I believe they are going to be doing something similar out at Via Este. There are laws in place that prevent major public projects being completed in-house and must be competitively bid, so we can't do this on everything. Our top departmental concerns, funding, we keep saying it, but there it is. Road worker attrition is a challenge due to more attractive, better paying work in the private sector. I don't know if you guys know, but the starting wage for a road worker is just $18 an hour. So obviously staff retention is tough. Years of revenue shortfalls, increasing expenses, some of the same things we discussed during the Public Works Administration presentation, has resulted in an aging fleet, dilapidated road offices, and deferred road maintenance. Much of our road equipment is quite old. For instance, our road superintendent is driving a hand-me-down 2008 Chevy, which we borrowed from surveying. And our road, yard, offices, and facilities, as Supervisor Brandon saw recently, are really quite deplorable. We've heard a lot from public safety during the ARP discussions, but I will say that roads are what get emergency personnel and the public in and out, and the condition of the roads can affect response time. And during storms and other road emergencies, it's often our road workers who are there first to respond. Any questions about roads?
Definitely no questions about roads at all, of course.
No.
Well, as you mentioned with the facilities out there, so yeah, this is just on my recent tour. I think we've all had the chance to go drive around our districts, and if not, definitely do so. I got to see some of the western centers that they have out in Jamestown area. You know, it's a roof and it is a building, but you go into the office and there's infestations in the attic. There's obvious water damage coming into some of the tiles, and it's a very inadequate space, even by, I think, a lot of the inadequacy we live with in a lot of other facilities, particularly bad. And how many people generally work out of that office? Was it about 10?
Yeah, I think it varies, but about 10.
Yeah, and this was not more than probably a 400 or 500 square foot divided room there. It was very tiny. I'd be very interested in seeing some select upgrades from facilities of just what could be done to improve that on a budget as a meaningful thing. I did have a couple of questions. So obviously in the past there was an issue many years ago related to roadside spraying. I wanted to ask about what limitations and steps are taken to make sure that if somebody's growing flowers along the road, they have a water source right next to there, that is not getting impacted.
So we do have an opt-out program, and you do have to give our office a call and register, and then all that information is relayed back to the vegetation spray program administrator, which is Scott Myers. They do have to have all of their applicator licenses, certifications in place, so it's not like we're just sending road workers out there and spraying willy-nilly. This is actually done by professionals, and so if you're in the opt-out program, we will ensure that your place is not sprayed. And they tend to avoid residential areas.
And all the chemicals, of course, they're up to date, state compliant, everything
yeah.
like that, of course.
Yeah,
Okay.
and we work with Kelly Schroeder as well to make sure that that we're in compliance.
I see she's nodding her head back there. Great, thank you. I think this might be something later on for the solid waste question. The limitations on contracting that you mentioned, this is definitely something I talk a lot with you about and then talk a lot with the public about. Can you say a few of the most common ones of when we can do work internally and just get it done, when we have to put it out to bid, maybe some of the overall regulations on some of these projects?
I would defer actually to Cody, but I think Blossom is more up to speed on this just recently, unless Sarah wants to. Okay, go ahead.
So public works projects, which there's quite a broad definition of, do have to, like I said earlier, have to be let to public bid if they are over $60,000. Routine maintenance, which does include surface treatments to the roads of less than 1 inch, that kind of stuff has no cap or rules under public contract code.
Probably can't get much done for $60,000 and under, right? I mean, a lot of these projects are large.
Absolutely.
Okay. And the one last question that I always end up getting, I'm just hoping you can give an answer, is I get some folks in line with that saying, well, why don't you just have a company locally go do this privately? Why do we have, obviously, Public Works doing that? I know that's a challenging kind of question, but I do just get it a lot.
Doing the actual work?
Doing the work itself. So
Sure.
what are the advantages of having us do this, you know, in-house, and maybe some examples too? Because I know you do contract out where it's the most financially viable option with these local partners too, but.
You want me to check? Yeah. Sure. So the public projects do have to be competitively bid. So of course, that goes to a contractor, low bid. A lot of our projects too are beyond the scope of what our crews can do or what equipment we have can do. You know, we're not set up to build bridges. We're not set up to install guardrail, you know, in large quantities, stuff like that. Go ahead.
I just want to clarify, are you talking about our major road projects or road maintenance?
I think probably either. They're generally general questions on that.
I mean, we could probably outsource a lot of things, but I think it's in our best interest to keep our road workers in-house. We have a lot of talent in-house. So a lot of our folks come from the private sector and have paving experience, like Mike Vignetti and some of his supervisors. So, yeah, I think it would cost us a lot more money if we went and outsourced that portion.
Okay, yeah, I think that was the root of what I was asking. Is
Yeah.
it cheaper? And every time I've ever asked, it always ends up being, no, it's quite a bit more expensive, given all the regulations and expertise required. So anyway, those are all my questions. Thank you.
No, I wasn't sure.
Okay, yeah, thank you very much. I can't let you go without talking a little bit about roads. Could you just kind of give us, you mentioned it here about the asphalt patching machine. I know we've purchased several pieces of equipment in the past period of time, or at least we're taking delivery on some. We got the vac truck, we got the patching machine, and then are we allowed to talk about the sweeper yet, or is that not?
No, and so
Okay.
we have ordered, I believe we have ordered, let me just look, we have ordered the street sweeper.
Okay.
And I made a mistake of calling it a vac truck. It is not. It is a street sweeper. It collects it
Well,
differently.
we bought a vac truck a year and a half ago, though. Yeah.
Oh, from TUD, the used one. I'm sorry. I was thinking new equipment.
It's near and dear to me because that was the first thing that
Okay.
I got to approve, was the new
Yay.
vacuum truck.
So I wouldn't hold out on the street sweeper arriving anytime soon. And we are still, the last I heard, we are still possibly getting some earmark congressional money for that street sweeper. I believe it was one of the things that continued to get passed on to the next level. So that money, if we do get it back, we could put it back into SB1 and do some paving projects. Our pothole patcher, I know Mike in the audience is he's so annoyed because I ask him every week where it is. But it's been manufactured. They are missing the two 7,000-pound axles. And it's a supplier issue. So it might be related to COVID, it might be related to trade, I don't know. So we don't have the pothole patcher yet.
So that's the holdup, is the axles.
We just need two 7,000-pound axles.
Okay, so anybody listening, if you
Right.
have access
Yeah.
to axles, we can start patching these dang roads.
Right.
Is there any kind of timeline, or are we just kind of waiting to hear back? Okay.
That's what you've been told for a while, though. so.
Yeah. Okay.
And just so you guys know, Mike Vignetti is going to actually have a pothole patching crew. So they will be dedicated to this effort where they'll be going to all the different districts and hitting the worst of the worst. So it should help.
Yeah, no, they've been out doing great work. I mean, every time I see them, I pull over and hop out and say hi. And so I know
Thanks.
they've been getting around and doing a lot of work in some of these key areas, whether it's brushing or striping. And you taught me something new. I didn't know that it's not actually striping, it's laying down
The thermoplastic?
ephemeral
Yeah.
plastic. There you go.
Burning down. I learn this stuff all the time. Mike, between all the mics, they have to set me straight
Yeah.
regularly. So,
Yeah, there's a lot more to it than just painting a line on
oh yeah.
the ground. So thank you very much.
Yeah,
And
okay.
please let everybody know how appreciative we are of the hard work they do.
We will do. Okay, so we're going to move on to fleet then?
Any
Oh,
public comment on roads before I let you move on?
Obligated.
Sorry, I just unmuted you.
I was going to say, since I'm the only one here, I feel kind of obligated. I want to thank you for talking about your maintenance offices. I've never seen those, but I've been to another department and seen their very plush and lush offices. So what would it take to fix up your little road maintenance offices?
Well,
Or do they need to be torn down and you get a little house or something instead?
We did cost this out a couple of years ago when we brought some SB1 projects to the board, so I'd have to go back and look at my notes, but we have estimates to repair the offices. And some are worse than others, so, but I don't think that we'd necessarily tear them down. We would try and keep them standing.
This is kind of interesting how two departments have two different kinds of offices when people are asking for money. I'll get off this topic once you're done discussing. Thank you.
Thank you. Any other? Okay. Please continue.
Okay, fleet services. So this is the group responsible for maintaining the county's fleet of light and heavy-duty vehicles and equipment, with the exception of the sheriff's office and fire. And we're talking about hundreds of vehicles, many of them aging. Our fleet manager himself drives a 2006 Chevy, but you wouldn't know it when you get in it. It's in mint condition, so. Some of our fleet's customers are Superintendent of Schools, Columbia Fire Department, Miwok Fire, and technical support for Columbia Elementary School. However, Road Division and Ambulance are the fleet's top priorities. This division operates a shop out on North Airport Road, employing 4 talented mechanics, and they operate with about a $700,000 budget. We'll go to recent department accomplishments. So some of our recent accomplishments, and these are just a few. I mean, these guys have lots. They did an in-house repair refurbishment of a water truck that was badly damaged about a year and a half ago. And they really saved the county a lot of money by going out and finding a used cab or chassis. Oh, cab. Anyways, they did all the body work themselves, and that is ready to go out and be used again, so we're very happy. So it saved us from having to buy a new water truck, which you guys know, they're hugely expensive. Mike and his team have also assisted with the online auctions of surplus vehicles, providing additional funds that go back into the road fund so we can buy new graders. They also completed the weights and measures truck for Calaveras County, so they've been doing some work for another county, which is great. And just in case you guys don't know, they provide services such as vehicle service and inspections, tire repair and replacement. They do air conditioning service and repair, and minor to major body work, to name a few. So top departmental concerns. Staff retention is probably key. These guys are really well sought after mechanics, and we've lost about 6 mechanics in the last 5 years to more competitive pay. You don't have to go very far in the valley. All those manufacturers are looking for mechanics. It's incredibly difficult to attract and retain skilled auto mechanics when the starting wage is $20.50 an hour. Obtaining relevant training for staff has been a bit tricky, only because of COVID. A lot of these guys have to do their training hands-on. Scheduling training with limited staff. As we said, we only have 4 mechanics, and one of them is Mike, our manager. And then succession planning for our fleet manager. Sadly, Mike has announced his retirement at the end of the year. He'll be taking with him decades of institutional knowledge, and finding a replacement for him will be a challenge. So, any questions about fleet services? Oh, okay.
Always. Just a couple. The first was, so I believe this doesn't cover vehicles for fire and law enforcement for most agencies, right? Or does it?
I don't know. We do fire for some other agencies, and we used to have county fire here. So I don't know. I believe that the reason they don't is because they felt it was more cost effective to go outside.
Okay. And I think the only other thing I really wanted to ask about, again, just going door to door, a number of people brought up the idea that they would love to try and work in a program that has apprenticeships to be able to teach some local kids, these skills. And same thing as an internship, but I think it's nicer an apprenticeship for mechanics. If that's a possibility, if that's something that maybe other areas have done that's effective, and if there would be room in the budget for something like that.
So the budget is the road fund. We would have to definitely look at that since it is quite small, but sometimes apprenticeships can also be, unpaid. But we would have to probably work with the college, I would guess, through a program, and talk to Ann, our HR risk manager, to see what all would be involved. But we can definitely look into that.
That'd be, I think, a really cool thing. Thank you.
Okay.
Any comments on fleet services? Okay.
Okay, so next is, I think it's our capital projects, and Blossom's going to cover this one.
If I can get this queued up. The engineering division is responsible for the overall management and coordination of improvements to the county's roads and bridges. The team works on all aspects of projects, including planning, budgeting, designing, environmental clearance and permitting, right-of-way acquisition, utility coordination, and construction oversight. Day-to-day maintenance of our road system is performed by our road maintenance team. As we said, but by law, any public project over $60,000 must be publicly bid. Since 2017, engineering has been working on storm damage projects, delaying our other capital projects. This year's budget is significantly higher than last year's, mainly due to the planned construction of some larger projects this year. We have 30 active capital projects in the 21-22 budget in various phases of work. Out of these, 24 are partially or fully grant funded. We anticipate constructing 8 capital projects and 1 storm damage project this year and into the next fiscal year. Some of the larger ones, of course, the Parrots Ferry Road intersection, our roadway signing and safety audit, which replaces the regulatory and warning signs on local roads, our Big Creek Shaft Bridge replacement, and the Phoenix Lake Road widening. We have about $5.7 million in grant funding, both federal and state, and about $2.5 million in SB1 funding in the capital budget. Some of our recent accomplishments, we completed 2 of our remaining major storm damage projects on Priest Coulterville Road and Little Fuller Road. We completed the Shaw's Flat Road SR 49 Safety Improvement Project. We've earned about $3.6 million in new grants in the last few months for the Jamestown ATP and the Twain Harte Storm Drain Project. And we've brought these larger projects to the point where they're ready to bid this summer and fall. Some of our top departmental concerns, delivering the timely projects with limited staffing. Again, the storm projects really kind of took all our attention there for a while and created quite a backlog of regular projects. And we routinely seek grant funding opportunities. We write grants almost monthly. Forward planning, of course, continuing to seek grant funding opportunities. That's something we do constantly. Completing the backlog of projects from the storm damage. I'm happy to report we're down to 2 out of dozens. And of course, employee development and succession planning, which Kim touched on during the Public Works Administration presentation. So, thank you.
Just one quick thing that I've been seeing a few more and more emails about has been stormwater recharge and discharges coming out and grant opportunities to kind of deal with those situations. Just in that, because obviously so much of this has been taken up with washouts and storm projects that can just be so expensive, and obviously you have to fix it right then, I mean, as soon as possible. Anything that we can maybe do to start planning on some of these stormwater runoff projects, and that if that's already a plan that's out there, it seems like there's grants there. Obviously, we're trying to get the Water Policy Committee, I think, back up and running, had our first meeting. It's just something that I'd be very interested in learning about for that discussion for future budgets.
Okay. And we were fortunate to partner with Twain Harte Community Services on a Prop 1 stormwater grant. And so we were able to get about $1.3 million as part of that larger grant award to revamp the Twain Harte storm drain system. So it's something we're definitely always looking for.
Yeah, and I was going to ask about so did you say that the ATP project on Fifth Avenue near the school, we'll be able to put that to bid this summer, you think?
No, we're actually just getting that one started. It's in the federal fiscal year 21-22. So we're going to be kicking that one off in the next couple months.
Okay.
Yeah.
So we're going to be getting the money in the next couple of months, or I'm not understanding what kicking off.
Oh, sorry, we're applying for the preliminary engineering funding.
Okay.
So that'll allow us to start preliminary design and then go into environmental studies. If I recall correctly, construction is scheduled for 2025.
Okay, yeah. Yeah, I mean, that's a huge, I don't think people realize how big that is for a county. And just a little bit of the history on it. We had applied for a similar type grant prior to that we didn't get. And so you guys kind of got together and I think TCTC helped as well.
Yes.
And applied for it again and kind of told the state, hey, you know, you just denied a project for a sidewalk in front of a school. And so kind of hit them with a little bit of the guilt there.
Yeah.
And I think that really helped us in the long run where we were able to get that grant awarded, so.
It did, and in the first couple of cycles of that program, it didn't really favor rural areas.
Yeah.
The people who run the program have kind of recognized that and made some changes, which helped us.
Yeah. Well, and they made those changes because you reached out to them and asked them to. So that's what I was trying to highlight.
Yeah, there was an awful lot of hours that went into that grant and that project. And, you know, unfortunately, we don't always win them. They're highly competitive. So the city was also in on that same cycle. And unfortunately, they did not get awarded the Dragoon Gulch improvements. So, yeah, this team did a really good job of doing, they had to do a lot of public outreach, working with TCTC, and we had some of the, I believe, CTC here actually walk the site and see how dangerous it was for kids as vehicles went zooming past us on Fifth. So,
Yeah. Anyway, I just wanted to say I'm proud of the work you did, and that even though we got denied the first time, we didn't give up and we kept at it, and now we have this great opportunity.
Thank you.
thanks.
Any other comment on capital projects? Any public comment? All right.
Hey, just real quick,
Oh, yeah.
thank you, Blossom and Kim, for that project up in Tweenheart. I know it's a big project, all the way from the shopping center down to the creek there, and it's a big project. So thank you for partnering on that. And as you guys know, you guys are probably in one of the most important hottest seats as far as constituents go with roads. So I just want you to know, this last year I have heard from people, and I've shared with you some emails, but it was confirmed last week when I spoke with more folks that they have seen more work done on our local roads in the last few years than they have in the last 5 or 10. And so I think that's reflective of you guys and Mike and keeping schedules and staying on top of, you know, the crews. I know we got good crews, but I think there's a little bit more vision and a little bit more umph in that direction. And I just want you to know that people are seeing it.
Thank you. I go to solid waste. Okay, so if there are do we have any other questions?
I don't think we do.
Okay, so we're going to go on to solid waste compliance, and Jim McCargy is going to come on up here and switch seats with me.
Hello, Jim McCargy, Solid Waste Director. I almost said good morning, but it is afternoon. I want to start off with a brief overview and discuss staff. And by the way, the OpenGov stories will require some further updating. So some of what I'll speak to today will be updated. The Tuolumne County Solid Waste Division is responsible for ensuring that solid waste and recycling services, including collection, transportation, and disposal, are provided responsibly and cost-effectively to protect public health and the environment and comply with all local, state, and federal laws and regulations. Currently, we have 3 full-time staff in the Solid Waste Division, which is not fully staffed, but it is a huge improvement over recent years. And so we appreciate the fact that we're able to get back to staffing levels that we need. Recent accomplishments, I would like to mention that the Solid Waste Division recently completed and passed the 4-year jurisdictional review by the primary state regulatory authority, CalRecycle. This process evaluates the county for compliance with the profusion of statutes and regulations. And I really want to publicly thank solid waste staff for this accomplishment. Additionally, we recently had some anti-littering signage installed in the county, and we're working on more signage, in particular in coordination with Caltrans on Highway 108 as folks enter the county. As far as top departmental concerns, I think first and foremost is the long-term liability and regulatory compliance of the county's 2 closed landfills. This involves extensive monitoring, sampling, testing, laboratory analysis, and reporting. Additionally, we this year will be completing the 5-year review report of the countywide integrated waste management plan, and this is in coordination with the city of Sonora, so it's a countywide review report. We also have the Big Oak Flat Groveland Transfer Station safety improvements. Also, illegal dumping and littering is a huge concern, and I'll talk a little bit more about that in just a moment. We have the waste hauler and transfer station agreements, including a request to exercise the 10-year extension of the Cal Sierra Waste Management Collection Agreement. And then lastly, we have the implementation of the SB 1383 Organics Waste Reduction Regulations. And on that, I would like to just focus a little bit on the SB 1383 Mandatory Organics regulations. They will become effective in January 2022, and this is going to require significant staff time and resources across many different county departments and agencies. The county is required to pass an ordinance or enforceable mechanism for implementation of SB 1383, and that will be required by January of 2022. Other requirements include education and outreach programs, which of course Solid Waste Division is very much involved in doing education outreach. There's also edible food recovery programs, which is going to significantly affect food banks, various community organizations, environmental health department, public health department. There's also compliance with new requirements for recycled content paper products. Of course, this is going to involve county administration, purchasing, and procurement. There's enforcement of new Cal Green building standards. This is going to involve building and planning departments. Adoption of new requirements for the Model Water Efficient Landscape Ordinance. This is building and planning departments again. And then there's establishment of an enforcement program for edible food recovery programs. And this will include involvement with county council, code compliance, and environmental health departments. And then lastly, there's record keeping and reporting. And of course, that's going to be across the board, all departments and agencies. So going to looking forward planning goals, Solid Waste has been looking into innovative programs to combat illegal dumping and littering. This has become a significant problem, as you all know, throughout the county in recent years. The county is confronting the homeless encampment issue and the significant waste generated and the associated environmental issues. There are increased health and safety problems, including the risk of wildfire with these encampments. Along with other Tuolumne County agencies, there are several grassroots, community-based organizations that are playing an important role in cleaning up illegal dumping. And that completes my presentation. Be happy to answer any questions.
Yeah, thanks for your report, Jim. I just have one question, and I know we can't start too early on the franchise agreements that are coming due next year, right?
Yes.
So when do you expect to start the board on our education process and what we need to know well in advance of these agreements coming?
Yeah, and just to inform all of you, the franchise agreements and the collection and transfer station agreements, this has been brought to the board's solid waste committee, has been discussed and is continuing to be discussed. So I would imagine that I think your fellow board members could speak to their involvement, but it is currently and has been discussed quite extensively.
Yeah. So you're talking about the contract with Waste Management. So we did an extension for when we would need to.
Oh, okay. I'm sorry. I think I can get to your question.
October. Yeah.
No. Yes. So the current franchise agreement with Cal Sierra Waste Management, they've exercised their request for a 10-year extension, which is in their contract. There was a 6-month extension provided to them this year. So by October 31st of 2021 this year, the county and the waste hauler, Cal Sierra Waste Management, need to agree or not agree to the extension. After that, there's 1 year following that when that agreement has to go in place. So the actual agreement isn't until October 31st, 2022. So between now and then, it will certainly come to the board.
Yeah, my point is that sometimes these things are quite involved. Sometimes these things are quite involved, and it takes, and I thought there was more than one of these types of agreements coming in 2022. I thought they were all up in 2022, all of the different, not just
The first one is this one. There is another one. There's 3 collection agreements and
right.
2 transfer stations. So between 2021, 22, and 23 actually is when these agreements come up.
Okay.
So we're kind of taking them sequentially as they come
Yeah.
up.
I was just hoping that we could, as a board, incorporate some of our needs as a county and as a community dealing with a lot of these issues with garbage on the side of the road and people not being able to afford their dump fees or whatever, and coming up with some creative solutions in order to address those and not just, re-sign on to another 10 years and not, it would be ignoring some of the problems we have right now. And I don't know what goes on in your solid waste meetings because I'm not part of that, so.
So I'll field that one if that's okay, and without going too far off
Yeah,
the topic. So Supervisor Goldenberg and I, along with members of the community and city council, sit on the solid waste committee, and this is actually probably the main, this topic and then the illegal dumping situation are probably the thing we spend most of our time talking about, and some of the potential options we've raised, because Waste Management does have, they have asks of us, and so that kind of opens up the question, okay, well, if they are asking more of us, then we need to ask more of them. And so those extend to providing free drop bins, which are those large, I forget how many cubic yards, but those large
30, 40-yard cubic
So-
yard boxes.
30 to 40 yards, and we would be able to fill that with any kind of illegally dumped trash and be able to take it to the transfer station free. And then we could certify, we have like one pile at a time, and these different groups that operate in the county would be able to make use of that. And so that would eliminate the need for finding money for transfer fees. That's just one option. There are others, having amnesty days for whether it's tires or
mattresses.
having those more often, having large, trying to eliminate this need for folks that don't have any trash service, where there's a risk there that they might dump it illegally, trying to address that. So those are just kind of really briefly, high level, going over some of the topics, but just going to your point, we're very much working on that and share many of your concerns, and before we make any, we'll be making a recommendation through the solid waste committee, but it'll come to the full board, and we'll have an opportunity to have everybody's input on it.
Great, and I thank you for going into little detail there, because I've been wondering and feeling anxious about it, actually, and since I can't be on every board, I don't know what's going on, so thank you for that.
Yeah.
Sure.
And it's certainly heavy on our minds as well, and a lot of communication going on with that provider and other providers, and seeing what's out there, because like you said, we haven't really opened this up for 10 years, and so it's time to see if this is the best fit, and if it's not the best fit, what is a better fit, and if it is a good fit, how are ways we can make changes that kind of meet the needs that exist today rather than 10 years ago. So anyway, I think I took more time than I wanted to.
I'll tag on just a tiny bit. We're also exploring, looking for if there's ways for appliances was another thing that we were trying to see if there might be grant funds out there for that. The one thing that's, high on my priority still, and You know, I know we've discussed it in committee, but I'm getting more and more strong community interest is coming up with some sort of green waste, you know, program pickup. And there's a lot of different flavors out there in different communities, but that one is very much desired and would really help us, especially in the springtime, you know, when we're asking people to do a lot of clearance around their properties too, and that would encourage them to get rid of, you know, those materials easily at no cost. So, thanks.
It was touched on just a little bit, but I'd say doing some of these cleanups with one pile at a time. We've had one person who came out and spoke in the public comment, Jen. She's been cleaning up Tuolumne Road almost every day, and just a local hero in addressing this. And even looking back over that road where she's gone, there's already more garbage accumulating behind her there. And so it's making a difference, yes, but the task is huge. And I know that your office, I think, is in the same position because it's a huge county. It's a lot to clean up. It's taken massive efforts on some of these with hundreds of people. And then it still, unfortunately, comes back. So I'm very excited because we need permanent solutions on this. I think One Pile and some of these groups, along with your office, are doing the best we can. But how do we stop in the beginning with really strict ordinances with teeth? Like I said, no mercy for litterers and dumpers in this county. How do we make sure that we make it a serious enough punishment that they're not going to do that? So happy to see that on there. Also equally interested in the Cal Sierra contract, and looking forward to hearing what my colleagues have to propose from the committee and some ideas on that as well. One question I wanted to bring up is the potential of any partnership in finding some revenue there to help support your office in other program or areas of doing pilot programs where some of the homeless who we normally are thinking they're the ones creating some of this garbage problem, and it's not all them, some locals, unfortunately, but it is a partly, caused by these encampments. They are paying them to go out and do this through job training programs or being able to work off, for example, fines and stuff like that. Is that something that's been explored that might be an option, if not direct revenue, but to kind of increase the capacity of folks you got actually out there, picking up garbage?
Yeah, I heard Jason Revord from One Pile at a Time come up here the other day, and he mentioned, as a diversion from the criminal justice system, maybe putting some folks, to work and helping with the work they do. I think it's a fantastic idea. And one thing I wanted to touch upon is, this illegal dumping, and I've been involved in solid waste over 20 years. And over the years, what I've learned is it's really a societal behavioral issue. And it's really got to be addressed. And there's been actually books and studies done on like community-based social marketing as a tool to use. Now, this way predates social media. This is a way of really getting to the root of the problem, and I call it the ick factor. So if you were to ask me to go throw my trash on the side of the road, my stomach wouldn't let me do it. I get that ick feeling inside, and that's the feeling we need to generate and instill in people, and I really think that's the ultimate solution to this problem.
I couldn't agree more and really appreciate you and your time here. Thank you.
Okay.
I just wanted to tackle one last comment. I forgot. We heard from the sheriff's staff yesterday, and apparently they're applying for some grant funds to maybe initiate that trash pickup, litter pickup using jail inmates. So if you haven't been in contact with them, you might want to, just kind of discuss it with them a little bit so that you're up to speed on what they're trying to do there.
I have been in contact with them, and yeah, this is one of the kind of innovative programs that I was referring to, and that we would like to actually, be able to incorporate that into, a franchise agreement potentially.
Excellent, thank you.
So I did have one really specific district issue, and this is just something that I'm worried about as an upcoming financial liability. Obviously, the Harvard mine, pit and reclamation, there's a trust governing that, I think with Mr. Adams and a number of folks, and public-private ownership there. As I understand, there's a contract to be paying into that over a number of years, but at some point, our portion of that ends, and I don't know if our liability ends at that point. So I'm kind of worried, I don't know, this might not be for right now.
Okay.
Yeah, but just worrying about the liability there of what we have as a county if this ongoing cost of the snow blowers and running the equipment is draining from a fund that is, static, and we're no longer contributing, but if we're on the hook. So certainly something on my mind for my district, and probably needing a lot of detail on that, but.
I was gonna say, that is something that we're looking at right now, currently.
Okay, great, thank you.
Okay. Thought I heard a noise from the speaker, so, so if Supervisor Kirk doesn't have any questions, I was just gonna say, very happy, you've been with us for less than a year, right?
About 6 months, yeah.
About 6 months, and, to come into this, with so many expectations, because obviously solid waste and illegal dumping is a huge issue in Tuolumne County. And not only that, you're a 3-person shop, so it's a pretty small department. To have this much responsibility, I think you handled it really well, and I think you, just in that short period of time, you've advanced the cause of making our community more beautiful to a great degree. And I'm right on board with really going after people that are dumping trash. You're going to get a $1,000 fine. You're going to have to cover the cost of what it costs us, the community, to clean it up. And you may pick up a misdemeanor charge, so anybody out there that's doing this kind of stuff, we're not taking it lying down anymore. And we got people like you keeping a lookout. So, and we've got the sheriff, code enforcement. So it's definitely not going to be overlooked like it was in the past. So.
Thank you.
Any other?
No, I'll just say you guys covered it all. I was just listening, and you covered it all. It's a quality of life issue, and thank you for your work. I know you've only been there for about 6 months, but you always communicate well, and I really appreciate that.
Thank you.
Supervisor Half reminded me of you might end up getting community service too, so you'll be stuck out there picking up other people's trash if you're dumping trash on the road. So keep that in mind. I know I'm watching for people. So okay, is there any public comment on this? All right. Thank you very much, sir.
Thank you.
Jim got lucky. His eval's coming up. We'll add those comments. Okay, so last but not least, we have surveying and GIS. The county surveyor's office is responsible for the review of subdivision maps, records of survey, public hearings for tentative parcel maps, and they provide research and guidance to the public and other departments such as engineering. On boundary and right-of-way issues, we're constantly pinging them for, is this actually the road right-of-way? So they're very helpful that way. Additionally, the surveying team maintains the uniform property numbering system, which is actually what we call addressing. And they've been doing that since 1975, the old-fashioned way, pencil and paper method, believe it or not. And we're calling this out because this task is actually often handled by the building department in other counties, but our folks are doing it, and they're doing a great job. And they provide that information, as you would imagine, to OES, USPS, TUD, PG&E, and so forth. So with only a staff of 2, if somebody's away, sometimes the addressing can be a bit delayed. GIS, this is your Geographic Information System. They actually compile all the maps with topical information. They maintain the databases for land parcels and county roads. And this small but mighty team of 2 supports the development community along with OES, the Sheriff's Office, Public Health, Road Operations, and CAL FIRE. And so when you look at your daily screening, your COVID dashboards that you see, those are all GIS products. Our recent departmental accomplishments, I think this might need to be updated, but surveying has processed 76 applications for parcel maps. Like I said, GIS provided that dashboard and the screening tools for public health. These are just a few things. I mean, all their accomplishments are very numerous. They created a user-friendly road closure map for the public, which is incredibly helpful during storms. and they completed surveys for sale of unused county properties supporting the CAO. Our top departmental concerns is filling vacant positions with competent technical staff. We've had an open land surveyor position for almost 2 years. We have some real concerns with attracting talent to the county and with succession planning, because I don't think Warren's going to stay with us forever. We are lucky that we have a retired annuitant, Gwen G., who's helping us out this past year. She's a former county surveyor for Santa Clara, so that's a real win for us. But it's obviously not sustainable. Recently, in order to help out with this problem, we removed the licensing requirement for the Land Surveyor 1 position in the hope of attracting an interested, albeit less qualified, individual who can grow into the role. And just so you guys know, there is actually a statewide shortage of surveyors. It's just a lot less people going into the field. Obviously, we have some concerns about response time for tasks. When you have a staff of only 2 in surveying and 2 in GIS, obviously if someone's away or there's an illness, then we're going to have a delay. Succession planning we already touched on, and the aging large format scanner printer you guys heard about during the ARP requests. So really that's, I was just going to, yeah, I could touch on that a little bit. Okay. I have to get my glasses on though. Nope, to go to the. Okay, so looking forward, planning goals, we do want to maintain a high level of service and provide the public with web access. So during COVID, we realized, because the building was closed, we actually were able to get a lot of folks kind of converted over to asking for things electronically, and we were able to provide that same level of service. So now we need to take it to the next level, which I think the CAO has talked about, digitizing documents and scanning and having some of these old records electronically available. And then we're hoping to increase efficiency, hopefully with the digitized scanner and documents, we will be able to provide this information in a more timely manner. So any questions about surveying and GIS? I do have the experts here in the audience.
Great. One comment and one question. I was just telling Warren earlier that, for public safety, for public health, for so many different things, for the supervisorial districts of who actually they're going to end up voting for on a ballot, we rely on GIS so much, and I don't think people realize quite as much, and it's absolutely critical. And so certainly very well received and a strong priority for me related to the software and the scanner for that to be able to help. One question, since GIS is such a universally used system, it's so important, so technical too, it's not available to everybody. Is there also a potential, especially with retention issues and trying to make sure that we are recruiting new people, to offer some type of apprenticeship in that office? Because that seems like somebody who's thinking about land use engineering and that would really jump at that chance.
So Madeline, you can feel free if you want to jump up at the podium if I make a mistake here, but Madeline has been working with the local college, with Columbia College, and developing an internship program.
That's great.
Yep.
Really happy to hear that. All right. Yeah, we're excited. Congratulations. Thank you.
Yeah.
So I just wanted to publicly acknowledge your GIS group. I guess you can call 2 a group, right? For those who may not know, they also, besides their regular day job, if there's a new Firewise community that wants to form and needs maps, I understand that they're helping those new Firewise communities with those maps. And I just want to publicly thank you for your service on that. It's a wonderful service, and it's helping move forward our #1 goal this year.
Yeah, and I agree completely. Whether it's Firewise or TUD or U.S. Forest Service or Fire Safe, it'd probably be easier to name the local groups that you haven't worked with. But surveying and GIS, these are things that you're not out in the public very much, but boy, the work you do is so important. If people don't really think about their lot lines until their neighbor starts to build a fence on their property, and then it becomes real important. And people don't necessarily think about where all the fire hydrants are in our community until we start having fires and it's fire season, and you need to know where these resources are. And I know that you've put a lot of work into mapping these things, to getting them tracked so that they're kept in an organized way and that they're not on some, handwritten map that's stuffed in a file, which, not making that up, there are
Yeah.
a lot of handwritten maps and files
Oh, yeah.
that tell where these things are, and I know you sifted through a lot of those, and making it possible for an ordinary person to understand the layout of our community. It's not something people think about on a daily basis, and yet it's extremely important. So it's good to highlight that and call you guys out for the work that you do.
And one more area that a lot of people aren't aware too is that 911 computer-aided dispatch systems, CAD systems, not CAD drawing, but CAD for dispatching to emergencies. They make extensive use of GIS and layers that, help them, the first responders, whether it be police or fire, have access to where certain things are, water systems and lots of other areas. So great work, thanks.
All right, any public comment? All right.
Okay, so if no other questions, that's kind of it for Public Works. I just wanted to close. We are a diverse group comprised of office and field staff, technical experts, and more than a few nerds, myself included. But what we all have in common is a dedication to this county. You heard our vision and our mission, and it's not just lip service. We really want to make Tuolumne County a better place, and we need your continued support to do that. So some final thoughts on what the board can provide to ensure Public Works is successful is your continued public support. And I am doing this, providing meaningful work, working on flexible schedules and helping folks manage their family and life-work balance. Comfortable, not luxurious, place to work, which includes workplace culture and competitive compensation. And thank you.
Thank you very much. Okay, any other final questions or comments? All right, thank you. Great job, have a good day. Oh, I'm sorry.
I just want to make a comment that every single time you have a meeting and they're scheduled to speak, they're here in the morning and they never get heard until the afternoon, or it's broken up. So for me as a taxpayer, that's very expensive to have them, even though I enjoy talking to Blossom, it's really expensive to have them sitting here for 4, 5, 6 hours. So maybe there should be a commitment that they'll be scheduled in the afternoon from now on.
Supervisor Campbell, could I just speak to that?
Sure.
We did not give time for anyone, just to be clear. So this, all of the department heads knew that it was an order of the agenda, but to the point we could schedule and put some in the afternoons, but that means you could not see Kim. Like today, when you got to her early, you wouldn't be able to go to that department early, so she would be here longer this afternoon. So it's definitely a give and a take, but I just want to make sure that everyone knew there were no scheduled times for any department heads.
Yeah, and Kim and I did have a little conversation prior to this to work it out.
Yeah, it's just
that
luck
would
of the
work with
draw.
your schedule, so.
Yeah, we have offered to, have some arm wrestling on the next one to see who gets the first. But yeah, there is no way we could, somebody will be waiting, so. But thank you, Carol.
Thank you. Okay, do you want to take a little break? Yeah, let's take a break. So we'll reconvene at 2:35. We are doing a budget study session. We are up to air pollution control, agriculture. So
Ready to take
Kelly,
away?
would you like to take it away?
Sure. Good afternoon, Chairman Campbell, members of the board. I am Kelly Schroeder, the Tuolumne County Air Pollution Control Officer, and in our audience with me is Bill Sandman, our current Deputy Air Pollution Control Officer. The Air Pollution Control District, or the Air District as we slang the term, is a regulatory agency first and foremost. The agency is responsible for implementing and enforcing most non-mobile sources of air pollution within the county. In terms of services, this mainly follows the regulatory path that is mandated which includes providing local businesses assistance in understanding and complying with local, state, and federal air quality regulations, acting as a liaison between state and federal agencies, and responding to open burning, smoking vehicle, and non-compliant business complaints. The Air District budget is 100% funded through state subsubvention, permitting fees, motor vehicle registration fees, notices of violation, and administrative monies from grants. Upon the availability of federal grant funds, we have helped local businesses acquire new buses, logging equipment, and diesel trucks. We have assisted in replacing hundreds of wood-burning stoves and have handed out hundreds of vouchers for green waste disposal. And this year we had several days of free drop-off days where you didn't have to have a voucher at a couple of our green waste facilities. We have a very small staff. It consists of Bill, our deputy, and one air pollution control specialist, myself, and an admin technician who is shared with Ag and Weights and Measures. The bulk of our work is completed by Bill and Scott, our air specialist. So some of our recent departmental accomplishments is that this year we gave out $911,000 in Carl Moyer and farmer grants, and we replaced $115,000 of wood-burning stoves that were non-compliant EPA devices in the county with EPA-compliant, either a wood-burning or a pellet stove. And again, we spent $28,000 on the Green Waste Recycle program, and that increased a lot. We found that we had a lot more participation with our free drop-off days than we did with our voucher program. So we're considering moving towards that direction this year coming up.
Commissioner, real quick question. For things like the wood stove rebate program and these grants, is that a set amount that you were given and then you're able to allocate, or are you facilitating them applying for a state or federal fund? I guess my question is there a way that we can get this information out so we're able to give more of these out? Or is this already doing the max we can?
You can sit here, Bill.
Bill Sandman, Deputy APCO. Yeah, it's state funding that we're getting, and it's one chunk of funding basically per year.
Okay.
And that really, it may go up, may go down a little bit based on state funding, but it's going to be pretty much the same.
That's great. And you're hitting it for the amount that we're getting and able to give out then?
Yep.
Great. Thank you. Good job.
Yes, in the wood stove program, we're not sure if the state is going to have the program again this year, but we have enough money in our budget that we're going to try and have our own program this year. And we do the green waste program on our own. Okay, so I know I'm a broken record, and I know everybody's heard this from all of the department heads, but we also have a recruitment issue. We don't have a retention issue other than I'd like to announce that Bill will be retiring in October. So after 20 years here, and also many years in Colusa. So he has over 30 years of experience that we will be losing when he retires. So I did run a recruitment, and we had 2 applicants. One didn't have the qualifications for the position, so I have 1 potential applicant for his position. And I'd just like to point out that a senior air specialist in San Joaquin Valley Air District starts at $42.50 an hour. Our deputy starts at $38.16 an hour. And a deputy there starts at $85.05 with a better benefit package. So almost twice the starting salary in the San Joaquin Valley, and they can work in Modesto, which is commutable to our county.
I'll see you later.
You can't go anywhere. And then the Placer County Air Pollution District, they have a air district similar to ours. It's a little bit larger, but their deputy starts at $57.47. And in Mariposa, they have 1 air district employee, and he is the environmental health manager. So it's not much of a comparison there. So one of my main concerns is filling this position. When Bill leaves, I'm going to be losing, again, 30 years of experience, and it's going to be a hard hit on our tiny little department. So with that, let's see. Yep, succession planning. Any questions for air pollution?
Just gonna say thank you, because I mean, that experience is really what keeps everything running. And certainly areas where we haven't had that experience, a lot of new people, it's good to have new people coming in. But it's really great to have that experience there to be able to build off of, to train it. And hopefully, even though we have no right to ask it, if you're able to stick around enough and still share some of that wisdom and be available. But you've already given a lot to the county, and I really appreciate that. So thank you for the 20+ years.
Thank you. I'd be more than happy to, I'd be more than happy to come back for a not to exceed type of thing to try to keep things moving, and so that we don't drop any programs or any mandates. But, yep.
Okay, I do have one more. We've been doing a lot of talking about the climate action plan, planning for that, as well as various kind of volatiles, greenhouse gas emissions, and particulate matter, stuff like that. There's a lot of changes in, I think, federal and state expectations of how we're going to hit that. I guess my main question isn't really where we're at right now. It seems like we're holding it together as much as the requirements are for our county, but if they go up significantly, what is the financial risk to Tuolumne County for being in non-attainment to the state as well as to the federal government?
Well, I think we're really talking apples and oranges. Greenhouse gas emissions are one thing. You're more likely to be non-attainment or officially non-attainment for criteria pollutants like ozone and carbon monoxide and particulate matter. So with greenhouse gas emissions, I think it'll most likely impact the largest sources within the county. We have really a very small GHG program, but there's a lot of reporting. I believe there's a lot of money that are fees that are put on these largest sources that go to the state. But yeah, the air district really doesn't do that much with GHG emissions. It's more the criteria pollutant and toxic pollutant emissions.
Okay, thank you.
Okay, any other questions for air resources or any public comment? All right, thank you very much. Oh, sorry.
You. Sorry. I don't mean to make light of it, but you can't go.
I'm getting old.
I'm sorry to hear that. I'm sorry to hear that you're going. I appreciate the many years that you put into, your position and bettering our air quality. And you are like the history book on what's happened in this county, and such a wealth of information. And when I worked with you as an analyst, I just learned tons. So it's hard for me to think that you won't be a permanent fixture here, at least for the next 4 years. So anyway, congratulations, and I'm for one, I'm very sorry to see you go, and I know you'll enjoy your time beyond life as a county staff member.
Thank you, and it's been an honor to work here. I love this county, and for county government, it's a different animal. I mean, you don't get paid a lot, and you are a public servant, and you either like that or you don't. And I just happen to appreciate that. So thank you.
Well, thank you. You've done an excellent job, above and beyond.
I agree completely, and you're a heck of a nice guy, too. So,
Thanks, Bill.
he's not gone yet, though. We got him till October.
Yeah, I'm not letting him
And
leave
then we're gonna
yet.
find sneaky ways to bring him back.
Yeah, I'm working on it.
That's tomorrow, as far as I'm concerned. Yeah.
Okay, would you like me to continue?
Yes, please.
Okay, so I'm also Kelly Schroeder, the Agricultural Commissioner, Sealer of Weights and Measures for Tuolumne County. So I will continue on with my presentation and talk about our Ag and Weights and Measures programs. So within our office, all of our activities that we conduct are mandated, and our costs are offset by contracts with the California Department of Food and Agriculture and the California Agricultural Commissioner and Sealer Association, mill assessment fees from the purchase of pesticides in California, unclaimed gas tax, and fees through county ordinances and a feed grazing contract. We work in several agricultural programs: pest exclusion, which we try and prevent the introduction, movement, and spread of injurious insect or animal pests, plant diseases, and noxious weeds. We inspect incoming plant shipments from other counties and other states, and we issue phytosanitary certificates for plant products to enter other countries such as Indonesia. We also work in the pesticide use enforcement program, in which all functions provide for proper, safe, and effective use of pesticides to protect public health and safety of the environment from environmentally harmful pesticides by prohibiting, regulating, and controlling their use. And as Kim mentioned earlier, her staff is certified through the state to apply pesticides, and we do inspections on them to assure that they are handling them properly and safely and applying them correctly. Our office issues restricted material permits and operator identification numbers, which is similar to a permit. We register pest control businesses to assure that they're properly licensed and they can legally apply pesticides in our county. And we register pest control advisors also, who help farmers understand what their pest issues are within their fields. And we conduct storage, use, equipment, and records inspections to assure that our growers are keeping their records properly. If they have employees, they're training them properly, and that they're applying their pesticides properly. We also investigate any complaints from pesticide use, whether it be household use or agricultural use within the county. And then within pest detection, this is a systemic, unbiased search for noxious weeds, insect pest, and plant diseases. My staff traps from May through October for insects such as gypsy moth, light brown apple moth, Japanese beetle, various exotic fruit flies, glassy wing sharpshooter, and the velvet longhorn beetle. Within our fruit and vegetable program, we inspect the 2 certified farmers markets in Tuolumne County. These are the City of Sonora and Peaceful Valley. We have an organic program, and we do inspections upon complaints for egg quality and retail produce. Within our nursery program, we inspect the local nurseries for cleanliness and compliance with industry standards. In pest eradication, we try and eliminate A and B rated pests. 6 of our targeted pests are weeds: spotted knapweed, Iberian thistle, Dyer's woad, skeleton weed, Canada thistle, and diffuse knapweed. Within pest management, this is the control of pests through chemical, mechanical, biological, and exclusionary methods. We have a contract with the USDA Wildlife Services for animal damage control. And we also work within other miscellaneous programs such as seed inspection and apiary inspection and registration. We also conduct or develop a crop report on an annual basis. We also work with the Ag Advisory Committee and work on portions of the Williams-Nacht program with CDD, and that's our ag programs. Within weights and measures, we do device inspections. We do annual inspections for accuracy and correctness of gas pumps, scales, propane meters, truck meters, and other non-PUC devices. In quantity control, we conduct audits and surveys of commodities sold by weight, measure, or count that are offered for sale to consumers. Audits are performed at retail, wholesale, and packing facilities. Within the Weighmaster program, we inspect licensed weighmasters for accurate and correct issuance of their certificates to assure that when they weigh something that they're doing it correctly. Within the petroleum program, my staff inspects gas stations for compliance with labeling and fuel quality requirements. And I'd like to say that we have run, let's do the, well, I'll leave it there. We have run these programs since February with just myself, one ag biologist, and the assistance of our admin tech. I was able to hire, in the last few weeks, a new ag biologist and a relief staff member. The ag biologist does not have any licenses, so she's starting from the ground up. We ran a recruitment for, well, I'll come back to that. So we ran a recruitment for a deputy ag commissioner. We were fortunate that you placed that in our budget for this year. Unfortunately, we ran it for a month and we did not have a single applicant. So some of my concerns are the experience of my staff. It is a very young staff. One biologist has been there just a little over a year, and my other biologist has 2 weeks of experience. So I'm going to have to spend the majority of my time training the new ag biologist and continuing to work with our existing biologist until they obtain their 8 licenses from the state in order to do the work completely on their own. And I still have to devote time to air pollution and to animal control and to my job as the ag commissioner. However, some of our accomplishments within my department is on average, they inspected about 600, Dawson did before he left, he helped, but Jesse's done the bulk of the work herself. About 600 weights and measures devices have been inspected. And between Roberta and Jesse, about 500 traps for pest eradication have been placed, or pest detection, I should say. So I'd just like to say that we're small, but we're mighty. They do hard work. They're tired like everyone else, but they're trying. And I was hoping to be able to send some of my 2 biologists to other counties to add to the training that I'm trying to provide. Rumor has it, though, that some of the counties are starting to restrict movement between counties again and don't want other county employees coming to their facilities. So I'll try and see what I can do about that. That is my 3 departments right there. Any questions?
Yeah, I was trying to imagine in my mind when you were going over all the bugs, the pests, and the noxious weeds, and I'm wondering if in a future presentation, this might be good for the community also to see pictures of what you're talking about. You know, you named them all, you rattled them all off, and it's like great, but to really be a community service, if the community knew better what you were talking about, and myself included, it would be great to see a picture of everything you were talking about.
Okay, we can do that. And
Yeah.
also we have a new weed contract through Department of California, Department of Food and Ag this fiscal year, and they used to have a weed management area group, and that's been disbanded for several years. But between Calaveras and Tuolumne County, we're trying to get that group back together. And we've reached out to numerous industry members, farmers, and anyone who's been interested in joining that group. So I can come back with that information as well, because the public is able to attend at their pleasure.
Right.
So I can come back with that information as well.
All right, great, thank you.
Yeah, I concur on that. You know, having, something with good photographs is really helpful, to be able to make that correlation. And there's a lot of different types of noxious weeds and things out there I found, and I've been dealing with yellow star thistle. On my property, I think I finally got rid of it, but it took like 5 years.
Yeah,
And just digging it out finally is the only thing that really worked. And
yeah, it is a tough one
Yeah.
to get rid of.
it is tough. Thanks.
Okay. Mm-hmm.
Okay. Supervisor Kirk, any other questions, comments?
No, you guys cover it all. I have to be much quieter when I work from home, and you guys do a good job of covering it. I'd like to congratulate the gentleman on his retirement and thank him for his service. It's pretty amazing to work for an organization that long. So thank you. And Kelly, I love working with you. You're always a professional. So thanks for what you do.
Thank you, and I appreciate that.
Thank you. And yeah, I agree with the sentiments tremendously. So yeah, you wear a lot of hats, but you do them all excellently.
Thank you, I appreciate that. I try. It's hard to juggle all the balls some days.
So who does have more hats? Is it you or Debbie Batista?
Oh, probably Debbie. I think I have more titles, but Debbie definitely wears more hats.
The two of you always rattle them all off.
Yeah, but Debbie doesn't get to play with bugs and cows and
Yeah,
air
that
pollution.
is the fun part of our job, is being out in the ranches and working with the growers and being outside. I have to admit, that is one of the perks of being in the agriculture industry.
Any public comment? Okay. All right, I think that that will conclude it for the day. Thank
Okay,
you very
thank you.
much. So I'll look to our CAO. Do we have anything else to discuss today, or shall we conclude?
I think we can conclude.
Okay. Thank you very much, all of the departments that came to present. Thank you for all of the people that tuned in and for our public comment. That's very appreciated. The folks that have been engaged in this. This is the second in a series of second in a series of budget study sessions that we're providing to the board and for the public so that people can get a better look at how their county government operates, where their tax dollars are spent, and who are the people that are actually providing these public services. Tomorrow will be the last in the series. We'll be talking with the Community Development Department, Auditor Controller, our County Clerk, Elections, Treasurer, the Office of Revenue Recovery, the Assessor, the Recorder, Archives, Business and Innovation Assistance, County Council, Administration, the Office of Emergency Services, Human Resources, Information Technology, Facilities, Veteran Services, Recreation, and Libraries. So a lot to cover tomorrow. Our meeting will be at 9 a.m. And with that, we'll go ahead and adjourn. Have a good evening, everyone.